and hello top notchers! Welcome back to our YouTube channel. Welcome to our NP5 Rationalization. And bago po tayo mag-start sa ating rationalization, gusto ko lamang pong pasalamatan ang mga subscribers na nagbibigay po ng ating super chat and super stickers, at sa mga ating audience na hindi po nag-skip ng ads, maraming salamat po. Especially po kay Ma'am Lenny Valdez, Ma'am Annie Rosiola, Ma'am Fat Mama, Ma'am Solis Brigette May M, Ma'am Zara Lynn Laksa, Ma'am Faye Dugan, Ma'am Dayan Kenneth de la Rosa, Rizaldo Bohol, Sergio Florendo, Maria Efleda Andes, kay Ma'am Pian, Madison Play Mindscraft, kay Sir Gregs RM, kay Nelia Criza Katubay, Ann Santos, Jan Vincent Doong, Joanne Serrano, Ma'am Crisana Beleno, Ma'am Ann Santos, Ma'am Sorayda Basman, si Renren Bisdap, Joanna Agawin, at kay Ma'am Jitsi Parcebal. So maraming salamat po sa inyong binibigay na suporta sa ating channel, and maraming salamat din po sa mga hindi nag-skip ng ads sa tuwing meron po tayong mga uploaded videos. Okay? So bago po tayo mag-start, iraraffle ko lamang po yung sinabi natin ng mga nagbigay ng super stickers. Sila pong ating iraraffle yung pangalan para makapagbigay po tayo ng ating secret files. Okay, so let's begin our rationalization with our question number 1. Nurse Mika shared the statistic that intentional self-harm was found to be the ninth leading cause of death among 20 to 24 years old Filipino adults. Increasing number of mental health problems may be related to 1. Poverty, 2. Age of the parents, 3. Family unemployment, or 4. Changes in family structure, or 5. Loss of community social support. So A, 1, 2, and 5. B, 1, 3, 4, and 5, C, 1, 2, 3, and 4, or D, 1, 2, and 3. Okay? So again, so ang tinatanong po dito is, increasing number of your mental health problems may be related to. Okay? So ano po bang pwedeng makapag-increase ng ating number of your mental health problems? So take note, nurses, that in the Philippines, almost 1 per 100 household, or 0.7%, has a member with mental disability, and that is according to the DOH SWS survey on 2004. So, as early as 2003, intentional self-harm was already found to be the ninth leading cause of death among 20 to 24 years old Filipino adults, and that is reported by DOH in 2003. Okay? So, take note also that the lifetime risk of major depression is increasing. So, mental illness is growing problem throughout the world. Kung tanungin ko sa board exam kung anong pinaka-most common anxiety disorder sa ating mental health, we have your phobias, okay? So, kasi lumabas din po yan sa board exam. So, take note that phobias and not post-traumatic stress disorders are the most common anxiety disorder. So, phobia daw po ang pinaka-most common anxiety disorder and not your post-traumatic stress disorder. So again, so in the Philippines, almost 1 per 100 households or 0.7% ang merong member sa family nila ang merong mental disability. Okay? Lumabas din po yan sa board exam. So, ang tanong sa ating question number 1 is kung ano daw yung nakakapag-increase ng number ng ating mental health problems. So, ano po ba yung mga stressful life situations na nakakapag-increase ng ating mental health problems? So, number 1, we have your family unemployment. So, stressful life situations like your family unemployment and changes in your family structures are risk factors for developing mental health problems. So, tama nga naman na kapag wala kang trabaho, wala kang source of income, nakaka-stress po yan at pwede po yan makapag-develop ng ating anxiety disorders and mga iba't ibang problema sa pag-iisip. So, we have your development of your mental health problems. So, we have also your lack of community resources like your poverty and the loss of community social support can also contribute to the risk of developing mental illness. So, ang isang option natin kanina, nandun yung aging age of the parents. So, take note that the age of the parents is not a risk factor. So, tandaan nyo po yan. So, age of the parent is not a risk factor. So, it could be a history of mental illness of the parents or in their family history but not the age of their parents. So, technique in your board exam, kapag mag-answer po tayo ng select all that apply question, pag hinahanap natin is mga positive answer, hanapin mo muna yung pinaka-obviously wrong answer, okay? So, dito sa ating option 1, 2, 3, 4, and 5, pinaka-obviously wrong answer dito yung ating age of the parents. Yun yung sinabi natin kanina. Pero kung wala kang kaalam-alam sa tanong, okay? So, tingnan mo muna yung mga choices na pwedeng positive talaga, yung pinaka-obviously positive na pwedeng hinahanap ng tanong. So, example dyan is yung poverty. So, di ba kapag poverty is one of the risk factor of the development of every diseases or any kind of diseases. Mapa-physical man yan or mapa-mental health problem man yan, okay? So, poverty po yan. So, one of the risk factor po yan. So, pasok lahat yung may mga number 1. So, yun nga lang sa ating A, B, and C, and D, nandyan lahat yung number 1, okay? So, the next number 2, age of the parents. Sabi natin kanina, ang age of the parents is not a predisposing factor in the development of your mental health problem. So, lahat ng may mga number 2, yan na yung possible na maling sagot. So, letter A, letter C, and letter D ay may mga option number 2. So, obviously wrong yung ating option number 2. So, tanggal na yung letter A, tanggal na yung letter C, and tanggal na yung letter D. So, the correct answer here is letter B. 1, 3, 4, and 5 lamang po ang sagot natin dito kasi yung age of the parents is not a risk factor for the development of the increasing number of your mental health problems. So, ganun lang po kadali kapag kayo mag-encounter or mag-answer ng ating select all that apply question. So, hanapin nyo muna yung pinaka-obviously wrong answer and tingnan yung choices kung nasaan yung option na yun. Then, i-cancel nyo lahat yun, okay? Tanggalin nyo lahat yun sa option. So, tanggal yung A, tanggal yung C, tanggal yung D. Ang natira ay letter B. So, take note, age of the parents is not a risk factor for the development of your mental health problem. So, yung ating history ng ating mental health or mental illness ng parent ay pwede, but not the age of the parents. Okay, so the correct answer here is letter B. Then next, for question number 2, in the care of families, crisis intervention is an important part of A, secondary prevention, B, tertiary prevention, C, primary prevention, or D, health promotion. Okay. So, pag sinabi po natin crisis is a perception or experiencing of an event or a situation as an intolerable difficulty that exceeds that person's current resources and coping mechanism. So, by definition of crisis, it is acute or it is self-limiting lang. Okay? Self-limiting lang po siya and it is usually resolved within 4 to 6 weeks. So, a crisis will not last more than 6 weeks. Hindi po siya tatagal ng more than 6 weeks. So, usually, nare-resolve po yan 4 to 6 weeks. So, if we say crisis intervention is a type of brief therapy that is more directive than typical psychotherapy or counseling, okay? So, pag sinabi po natin crisis intervention, that is part of our secondary level of prevention. So, take note also that the goal of your crisis intervention is to create stability for the person involved in the crisis while promoting self-reliance. And remember also that there are 3 levels of your crisis intervention. So, number 1 is the primary level. So, pag sinabi natin primary level, that is the preventive level. So, prevention po ang ginagawa natin dito. And example of your prevention for primary level of your crisis intervention is, example is your finding shelter for an abused woman and her children and offering sick leave and shelter for homeless person. Okay? So, yung ating paghahanap ng ating shelter for an abused woman and her children, at saka yung shelter for homeless person, that is under your primary level of your crisis intervention. Then next, pag sinabi natin crisis intervention, intervention is under the secondary level of your crisis intervention. So, secondary level of prevention po siya. So, crisis intervention is under your secondary level. And pag sinabi naman po natin tertiary level, ang tertiary level natin is the rehabilitation level, okay? So, rehabilitation, example dyan is assisting client in planning a regular lifestyle and minimizing sources of stress, and educating the client with family regarding medication adverse effects and your potential interactions. Again, so pag primary level, that is your prevention stage of your crisis intervention. Secondary level is the crisis intervention, and tertiary level is the rehabilitation. So pagbalikan natin ang tanong natin dito sa ating question number 2, saang level of prevention daw ang ating crisis intervention? The correct answer here is secondary level of prevention. Kasi ang nasa primary level is your prevention, okay? So, ang secondary level is your intervention, and the tertiary level is your rehabilitation. Again, so the correct answer in your question number 2 is your letter A. Secondary level of prevention po pag sinabi nating crisis intervention. So, always remember din pala, nurses, na meron po tayong 3 types of your crises. We have your maturational crisis, we have your situational crisis, and we have your adventitious crisis. Yung ating maturational crisis, ito yung mga nag-a-arise sa mga developmental changes in life cycle of a person. Example doon is yung adolescence, marriage, parenthood, birth of a child, and yung retirement. At yung common na lumalabas sa board exam sa ating maturational crisis is yung marriage, okay? Tandaan nyo po yan. And pag sinabi naman po nating situational crisis, it is the crises that arises from external events. Example naman ng ating situational crisis ay yung loss of job, nawalan ng trabaho, ano pa? Abortion, financial status, ano pa? Divorce, and presence of your severe illnesses. Okay? And pag sinabi naman po nating adventitious crisis, it can be the result of your major natural disasters, man-made disasters, or mga crime of violence. Okay? So, yun yung mga results from accidental events or mga unplanned events like your earthquakes, floods, ano pa, mga riots. So, yun yung mga yun, okay? Explosions. So, example nun ng mga adventitious crisis. Again, pag maturational, that is your crises that arises from developmental changes in life cycle of a person like your birth of a child, adolescence, marriage, parenthood, and retirement. Yung common sa board exam sa ating maturational is yung marriage, okay? Ang situational crisis naman, yan yung mga nag-aaray sa mga external events or external sources like yung loss of job, ano pa, yung abortion, financial status, divorce, and your severe illness. And sabi ko nga kanina, pag sinabi naman nating adventitious crisis, these are the crises that can be triggered by major natural disasters, man-made disasters, or mga crime of violence. Example, mga rape, mga earthquake, mga floods, tsunami, ano pa, typhoon. So, yun yung mga examples ng ating mga adventitious crisis, mga riots and mga explosions, okay? So, yun po yung ating adventitious crisis. So, balik tayo dito sa ating question number 2. In the care of families, crisis intervention is an important part of letter A po ang sagot natin dyan, secondary level of prevention. So, A is the correct answer for question number 2. Then next, for question number 3, the nurse observes that a client with bipolar disorder is pacing in the hall, talking loudly and rapidly, and using elaborate hand gestures. The nurse concludes that the client is demonstrating which of the following? A. Aggression, B. Anger, C. Anxiety, or D. Psychomotor agitation. Okay? So, encircle the word your bipolar disorder. Ang condition ng patient or client is bipolar disorder. So, pag may bipolar disorder dito, pwedeng nasa manic phase po siya. Kasi nga, the patient here is pacing in the hall, talking loudly and rapidly, using elaborate hand gesture. So, this patient is demonstrating which of the following? A, B, C, or D? Okay. So, the correct answer here in your question number 3, hindi po yan anger at hindi po yan aggression, okay? Take note, bipolar disorder po yung client natin. So, pag may bipolar disorder po ang patient natin at nagkaroon po tayo dito ng pacing in the hall, talking loudly and rapidly, ano pa? Yung parang nagnanak po yung mga kamay nila sa mga wall, that is a sign of psychomotor agitation, okay? So, the correct answer here is letter D, okay? Psychomotor agitation po yung pinapakita ng ating bipolar patient. So, take note that during your manic phase of your bipolar disorder, common po dito yung ating psychomotor agitation. So, pag sinabi po natin psychomotor agitation is a symptom related to a wide range of mood disorder, but it is common in your bipolar disorder during the manic phase of this condition, okay? So, people with this condition engage in movements that serves no purpose, okay? So, examples ng kanilang mga movement ay yung ating pacing around the room, tapping feet or toes in the floor, tapping their fingers on the surfaces, or rapid talking. So, ang pinapakita po ng ating question number 3 is a psychomotor agitation of your patient with a bipolar disorder. So, the correct answer in your question number 3 is letter D. Okay? So, psychomotor agitation po ang sagot natin sa ating question number 3. Then next, for question number 4, Rowena revealed that she has a tendency to manipulate others. So, what would be the most appropriate short-term goal for her? For Rowena to A. Have an intimate relationship, B. Acknowledge her own behavior, C. Stop arguing with other people, or letter D. Express her feeling verbally. Okay, so ang tinatanong po dito is the most appropriate short-term goal. So meron po siyang manipulative behavior. So sino po ba yung mga merong mga manipulative behavior? So sila lang naman yung mga may mga borderline disorders, mga antisocial personality disorder. So, if we say manipulation, manipulation is the practice of using indirect tactics to control behavior, control emotions, and control relationships. So, manipulation is a particularly common with personality disorders like your borderline personality and your narcissistic personality, and also with your antisocial personality. So, in borderline personality disorder, it is characteristically demonstrates by manipulative, splitting, and self-destructive behavior. So, consistent limit setting is vital for the patient's safety but also to prevent splitting other staff. Kasi common po dito yung splitting. Pinaglalaroan po nila yung mga staff, okay? So, take note kapag ikaw yung nurse na nag-aalaga sa ating patient with borderline personality disorder, never ask a question with why, okay? So, wag kang magtatanong ng why questions kasi not therapeutic po yan sa mga pasyenteng may borderline personality disorder. So, when you are caring for a patient with borderline personality disorder, do not give in, okay? Wag kang bumigay, okay? Kasi kailangan hindi ka bumibigay sa pasyente mong merong borderline personality disorder kasi nga nilalaro nila yung mga staff dito. So, when you're caring for a patient with borderline personality disorder, you must provide a consistent limit setting. And take note that why questions are not therapeutic for these patients. So, the short-term goal for your patient with your BPD is for them to acknowledge their own behaviors. So, the correct answer in your question number 4 is letter B, acknowledge her own behavior. So, that is the most appropriate short-term goal for Rowena, to acknowledge her own behavior. So, B is the correct answer here. Then next, for question number 5, Rina says, my dead mother ordered me to kill my 2 children before the devil could get them. So, what behavior is being manifested by Rina? A. Auditory hallucination, B. Visual hallucination, C. Tactile stimulation, or letter D. Olfactory hallucination. So, keyword in your question number 5, nandun yung word na ordered me to kill my 2 children. So, pag merong nag-o-order, that is a form of command hallucination. So, command hallucination is the most common form of your auditory hallucination. So, the correct answer in your question number 5 is letter A, auditory hallucination po ang sagot natin dyan. Kasi nag-o-order po yung voice na naririnig ni Rina. So, ordering is a command hallucination, and command hallucination is the most common form of your auditory hallucination. So, if we say hallucinations, hallucinations are false sensory experiences without the presence of your stimuli. So, walang stimuli. So, meron siyang naririnig na wala tayong naririnig. Meron siyang nakikita na hindi natin nakikita. So, the most common form of hallucination are the auditory hallucination. And the most common type of your auditory hallucination is the command hallucination. Hearing voices telling you to harm yourself or others. And that is most common in your patient with schizophrenia. Tandaan niyo po yan. Ang pinaka-common na hallucination sa mga patient with schizophrenia is your auditory hallucination with command hallucination. The next, number 2, pinaka-common na hallucination type is the visual hallucination. May nakikita na hindi natin nakikita. So, without the presence of stimuli, may nakikita yung patient natin. So, visual hallucination is more common among patient with dementia, yung may mga Lewy dementia or mga Parkinson's disease dementia. So, again, so ulitin ko, ang ating schizophrenia, ang common sa kanila ay mga auditory hallucination, while your patient with dementia, common sa kanila yung visual hallucination. So if we say auditory hallucination, this type of hallucination involves the perception of your sound. So hearing po. So typically may naririnig po silang mga voices. So pag meron po silang naririnig na voices, ang tamang gawin natin as a nurse is to ask the patient what are those voices saying to them. Ano bang inuutos ng voice na yon? Ano bang sinasabi ng boses na naririnig mo sa iyo? Okay? So that is your auditory hallucination. Bakit natin kailangan malaman kung anong inuutos or sinasabi ng boses? Kasi nga baka mamaya inuutosan na siyang patayin ka or saktan niya ang kanyang sarili. So mas mapanganib po yun. Okay? The next, visual hallucination. So visual hallucination involves the sense of your sight. So it may consist of formed images like people or unformed images like your flashes of light. And pag sinabi naman po natin gustatory hallucination, lumabas na po yan sa board exam. Gustatory hallucination involves the perception of your taste, usually unpleasant taste. So minsan sasabihin ng pasyente mo na meron siyang nalalasan sa kanyang pagkain, nalason, or kahit wala ka naman nilagay na lason din is sasabihin niyang nilason mo siya dahil may nalalasan siyang lason sa kanyang pagkain or unpleasant taste sa kanyang pagkain. So that is your gustatory hallucination. So pag may kinalaman sa inyong panlasa, that is a gustatory hallucination. So take note, lumabas na po yung gustatory hallucination na yan. So yung patient may nalalasan na kakaiba sa kanyang pagkain, that is a gustatory hallucination. Next, we have our olfactory hallucination. So pag sinabi naman nating olfactory hallucination, it involves your perception of odor such as burning rubber or decaying fish or kahit ano pang masasamang amoy, okay? So meron siyang naaamoy na hindi natin naaamoy. So ibig sabihin yan, there's no stimuli. So walang stimuli para masabi natin siyang hallucination. So olfactory hallucination, it involves your sense of smell. And pag sinabi naman natin somatic hallucination, it involves the perception of a physical experience localized within the body. So example naman, somatic hallucination, sasabihin ng pasyente mo na may ahas na gumagalaw sa loob ng kanyang tiyan. That is a somatic hallucination. Or ano pa, feeling ng pasyente mo na aagnas na ang kanyang tiyan, naagnas na ang kanyang dila, natutunaw ng kanyang mata. That is your somatic hallucination. And pag sinabi naman nating tactile hallucination, it involves perception of being touched or something is being under one's skin, okay, such as something creeping, something crawling, or something's biting, stinging insect on the skin, or any worms or mga uod daw na nasa kanyang balat, okay, so under the skin. So yung mga ganun, that is known also as a formication, okay. Formication din ang tawag natin doon pag sinabi niyang na merong gumagapang na uud sa kanyang ilalim ng kanyang balat or under the skin, meron siyang nararamdaman na gumagapang or creeping or crawling worms, okay? So yun po yung ating mga tactile stimulation, biting, stinging, crawling. So yun po yung mga examples ng ating tactile stimulation, or may kumalabit or meron siyang naramdaman na kumalabit kahit wala namang kumakalabit sa kanya, okay? And meron din tayo ditong tinatawag na hypnagogic hallucination at saka hypnopompic hallucination. Pag sinabi natin hypnagogic hallucination, this is having hallucination while falling asleep. And pag sinabi naman natin hypnopompic hallucination, having hallucinations while waking up. Okay? So yun po yun. So dito sa ating question number 5, since my order, my command, that is letter A, auditory hallucination po yan. A is the correct answer here. Then next, for question number 6, the context of a verbal communication is the A. Use of understandable words, B. Use of literal words, C. Use of clear sentences, or D. Environment where communication occurs. So, context of a verbal communication po ang tinatanong dito. So, take note, lumabas na po ito sa board exam. So, if we say context of a verbal communication is the environment where communication occurs. So, letter D is the correct answer for your question number 6. So, remember nurses that if we say communication is the exchange of information or ideas between one or more person. Okay? So, between persons po yan. So, we have your communication process here. We have your number 1, the source. Source where the message begins. And number 2 is the message, the information you want to communicate. And the number 3 is encoding. So, encoding is transforming a message into an understandable sign and symbol system. So, speaking is encoding as a writing, printing, and filming a television program. So, example ng ating encoding is yung pagsasalita. So, speaking is encoding, writing is encoding, printing is encoding, and filming a television program is also an encoding. Okay, tandaan nyo po yan. And pag sinabi naman po nating channel is the method of communication used. So, example of your channel is verbal, written, and non-verbal. So pag sinabi mong verbal, so orally spoken po yan, written, and non-verbal naman by means of your movements and gestures naman po yan. Okay? So that is your number 4, the channel or the method of communication used. So, number 5 in your communication process is decoding. So, if you say decoding, interpreting the encoded signs and symbols. So, example of your decoding is listening, reading, watching television show. So, yun pa yung mga examples na ginagawa natin to decode your information. So, listening, reading, watching television show. These are examples of your decoding. And receiver. So, pag sinabi natin receiver, siya po yung decoder natin. Okay? So, receiver is the listener, reader, or observer in the communication process. So, another name for receiver is the audience also. And number 7, the feedback. So pag sinabi naman po natin feedback, feedback is the receiver's response to a sender's message. At dito na nga sa ating number 8. So if we say context, context is the situation in which your message is delivered. So this may include the surrounding environment or broader culture like the corporate culture, international cultures, and so on. Okay? So pag sinabi natin context, that is the environment where the exchange of information occurs. And take note that a breakdown in communication can occur in any stage of communication process. So here in your question number 6, the context of a verbal communication is the environment where communication occurs. So letter D is the correct answer, and take note, ito po ay lumabas na sa board exam at possible na ulitin yan ulit sa board exam. So letter D is the correct answer here, okay? Then next, for question number 7, verbal communication is the use of words when talking to your patient, and the use of literal words when you speak is the A, understandable phrases, B, content, C, the circumstances, or D, understandable sentences. Okay? So ano daw dito yung use of literal words? So the correct answer here is letter B, the content of the message. Take note, content is the use of literal words when you speak. So boy is the correct answer here, B. Okay? So content po ang sagot natin dito. So take note, magkaiba po ang ibig sabihin ng content kay context. Pag sinabing content, verbal communication, literal words that a person speaks. And pag sinabi natin context, it is the environment in which an event occurs. Okay? So number 7, the correct answer here is letter B. Content is the literal words, the use of literal words. Okay, so next question number 8. Which of the following give meaning and context to the message? A, process, B, phrases and sentences, C, context, or D, thoughts and feelings. So A, B, C, or D. So take note, nurses, that the following that gives meaning and context to the message is the process of communication. Okay? So letter A is the correct answer for question number 8, and that is a common board question. Lumabas na po yan sa board exam. So letter A is the correct answer. So process gives meaning and context to the message, not your phrases, not your context, and not your thoughts and feelings. So it is your process of your communication that gives meaning and context of the message. So A is the correct answer here. Then next, for question number 9, which of the following situation is an example of incongruent message? A, when the nurse means what she says. B, when the words and behavior of the nurse agree. C, when what the nurse says and does do not agree. And D, when content and process agree. So, incongruent means hindi tugma, okay? Hindi tugma ang pinapakita ng ating example dito. So, yung letter B natin, when the words and behavior of the nurse agree, that is a congruent message, okay? So, mali ang letter B kasi congruent message po yan, pati yung ating letter D and letter A. So, tumutugma sa sinasabi nila. So, yung letter C, incongruent yan kasi sabi dito, when what the nurse says and does do not agree. So, hindi tumutugma yung sinasabi niya sa kanyang kinikilos or ginagawa. That is a form of incongruent message. So, the correct answer in your question number 9 is letter C, when what the nurse says and does do not agree. Then next, question number 10, the nurse is caring for a client hospitalized with bipolar disorder. So, manic face po yung ating patient dito. So, which of the following snacks would be best for the client with mania? So, pag may mania, kadalasan ang binibigay po natin dyan is mga finger foods, okay? Mga finger foods na mayaman sa calories and protein. So, alin dito sa ating choices ang mayaman sa protein and calories? Potato chips, apple, diet cola, or milkshakes, okay? So, here in your question number 10, the best answer here is your milkshake. Kasi ang milkshake ay punong-puno po yan ng ating calories. Okay, so mayaman na yan sa calories, mayaman na yan sa nutrients, and mayaman na din po yan sa protein. So letter D is the best food or snack for your patient with bipolar disorder during its manic phase. So letter D po ang sagot natin, milkshake po ang best na isasagot natin dito. So take note that finger foods or things clients can eat while moving around are best option to improve nutrition like your peanut butter, sandwich, and milk. Such foods should be as high in calories and high in protein. So tanging yung gatas lamang po dyan or yung milkshake dyan ang mayaman sa fat, sa calories, and protein sa ating mga choices. So the correct answer here is letter D. Milkshake po talaga ang pinaka-the best na isasagot natin pagdating sa board exam. So the correct answer here is letter D. Milkshake po yan. Then next, for question number 11, Nurse Fatima should pursue assessment of suicide risk for individuals who display tendencies to be A. Compulsive, obsessive, or weak, B. Hostile, impulsive, or depressed, C. Risk-taking, aggressive, or controlling, or letter D. Blaming, abusive, or confused. So, ang pinag-usapan po natin dito sa ating number 11 is your suicide risk. Okay? Ano yung pwede lang i-display na tendencies for suicide? So, A, B, C, or D. So, take note nurses na kapag tinanong kayo sa board exam kung ano yung neurotransmitter that has been implicated as playing a part in the decision to commit suicide, your answer in the board exam is serotonin. Bakit? Kasi low serotonin levels have been noted among individuals who have committed suicide. So, ang pinaka-neurotransmitter natin that playing part in your suicide is serotonin. And take note also that the three aspects of personality which is most closely associated with increased risk for suicide are aggression, hostility, impulsivity, and your hopelessness or depression. So, take note that the presence of impulsive behavior is a primary risk factor for your suicide. Okay, so meron po tayo ditong presence of impulsivity, hostility, aggression, hopelessness, or depressed. Okay? So kapag meron po tayo na encounter sa board exam na suicidal patient, take note that the suicide intervention that has the greatest impact on a client's safety is the one-on-one observation by staff. Okay? So one-on-one observation allows for constant supervision which minimizes the client's opportunities to cause self-harm. So yan po yung pinakamagandang intervention na gagawin natin kapag yung ating patient is increased risk of your suicide. One-on-one observation. Okay? So pero kapag ang patient natin is meron siyang covert reference to suicide or hindi mo siya makitaan ng mga manifestations of suicide risk, the nurse should ask the client directly if he or she is thinking of attempting suicide. So isa rin yan sa pinakamaganda para ma-break natin yung ating suicide. Okay? So kailangan directly i-ask natin yung patient kung meron po siyang plan to commit suicide. Okay? So in your question number 11, Nurse Fatima should pursue assessment of suicide risk for individuals who display tendencies to be. So sabi natin, one of the primary factor for your suicide risk is your impulsivity, okay? And your hostility. So the correct answer here is letter B. So remember nurses that the three aspects of personality that most closely associated with increased risk of suicide are aggression, hostility, impulsivity, hopelessness, or depression. So the correct answer here is letter B, hostile, impulsive, or depressed. Okay? Okay, so next question number 12. Which of the following give cues to the nurse that the client may be grieving for a loss? A. Sad affect, anger, anxiety, and sudden changes in mood. B. Thoughts, feelings, behavior, and physiologic complaints. C. Hallucinations, panic level of anxiety, and sense of impending doom. Or D. Complaints of abdominal pain, diarrhea, and loss of appetite. So, alin daw dito yung ating mga cues that the client may be grieving for a loss? So, what is grieving? Okay, so if we define grief, grief is emotional response of individual to loss expressed physically, emotionally, socially, and spiritually. So, it can take weeks to years po yan. So, series of intense physical and psychological responses that occur following a loss is a normal and natural and necessary and adaptive response to a loss of an individual. So, ang cues natin that a person is grieving are the following. So, thoughts, feelings, behavior, and physiologic complaints. So, yun po yung mga cues natin na pwedeng gamitin natin that the person is undergoing your grieving process. We have your thoughts, feelings, behavior, and physiologic complaints. So, back to your question number 12, which of the following give cues to the nurse that a client may be grieving for a loss? So here in your question number 12, A, B, C, or D, asan daw dyan yung thoughts, feelings, behavior, and physiology complaints? The correct answer here is letter B, okay? So thoughts, feelings, behavior, and physiology complaints gives cues to the nurse that the client may be grieving for a loss. Okay, so B po ang tamang sagot natin sa ating question number 12. Then next, question number 13, situations that are considered risk factors for complicated grief are A. Inadequate support and old age, B. Childbirth, marriage, and divorce, C. Death of spouse of child, death by suicide, and sudden and unexpected death, or letter D. Inadequate perception of the grieving crisis. So alin po dito yung ating mga risk factors for complicated grief? So, what is complicated grief? Okay, so pag sinabi po natin complicated grief is considered when an individual's ability to resume normal activities and responsibilities is continually disrupted beyond 6 months of bereavement. So, kapag more than 6 months kang nagluluksa sa na-loss or nawala, that is a complicated grief, okay? So, signs and symptoms of complicated grief will include your maladaptive thoughts and behaviors related to the death or the deceased individual, and continuous emotional dysregulation about death and social isolation and suicidal ideation. So, nade-depress po yung taong nag-undergo ng ating complicated grief. Okay? So, the risk factors for complicated grief are the death of spouse or child, death by suicide, and sudden and unexpected death. And one of the vulnerable factor for your complicated grief are the loss of your self-esteem, loss of your trust to others, ano pa, yung may mga previous psychiatric disorders, mga alcoholic individuals, and kung merong absent or unhelpful member of the family. So, back in our question number 13, situations that are considered risk factor for complicated grief are letter C, okay? So, letter C is the correct answer here, the death of spouse or child, the death by suicide, and sudden and unexpected death. So, for question number 13, the correct answer here is letter C. Then next, for question number 14, physiologic responses of complicated grieving include A. Tearfulness when recalling significant memories of the lost one, B. Impaired appetite, weight loss, lack of energy, palpitations, C. Depression, panic disorders, or chronic grief, or letter D. Impaired immune system, increased serum prolactin level, and increased mortality rate from heart disease. So, alin daw dito yung physiologic responses of a complicated grieving, okay? So, if we say physical expressions of your grieving process, we have your crying, sighing, headaches, loss of appetite, difficulty sleeping, weakness, fatigue, feelings of heaviness, aches, pain, and stress-related ailments, okay? So, meron din ditong weakened immune system over time and more frequent episodes of illnesses. For person who have chronic illness, it can exacerbate your condition. So, kapag meron kang sakit sa puso, pwede kang mamatay sa sakit sa puso kapag nagkakaroon ka ng complicated grieving, okay? So, back into question number 14, physiologic responses of complicated grieving include letter D. Okay, so it is the impaired immune system, increased serum prolactin level, and increased mortality rate from heart disease. So, letter D is the correct answer here. And for question number 15, the nurse would expect to see all the following symptoms in a child with ADHD except A. Easily distracted and forgetful, B. Excessive running, climbing, and fidgeting, C. Moody, sullen, and pouting behavior, or letter D. Interrupts others and can't take turns. Okay? So, alin dito ang ating sagot? So, except po ang tinatanong dito. Pero nung lumabas ito sa board exam, wala po siyang word na except. Okay? So, A, B, C, or D. So, remember, nurses, in your board exam, ADHD is common, okay? Common concept po yan sa NP5. So, if we say attention deficit hyperactivity disorders, we have our 3 key behaviors or hallmark signs of ADHD. So, it includes your EHI mnemonics, IHI mnemonics. We have our inattention, hyperactivity, and impulsivity, okay? So, but in preschool child, the most common ADHD symptom is hyperactivity. And take note also, nurses, that ADHD symptoms starts before the age of 12. Again, ulitin ko, the 3 key, okay? The 3 key behaviors of your ADHD or the hallmark signs of your ADHD are the following: inattentiveness, hyperactivity, and impulsivity. So, alin dito sa choices ang hindi nagpapakita ng inattention, hyperactivity, and impulsivity? So kung titingnan natin dito sa choices, yung letter A natin, easily distracted and forgetful, that is inattention, okay? Inattention na common sign din yan ng ADHD. Then yung letter B natin, excessive running, climbing, and fidgeting, that is a hallmark sign of your ADHD, which is the hyperactivity. And yung letter C natin, moody, silent, and pouting behavior, wala po yan sa ating ADHD. So hindi po yan yung ating pinaka-expectation na makikita sa ating patient with ADHD. Yung letter D natin, interrupts others and can't take turns, that is impulsivity. So the correct answer here is letter C kasi except po yung tinatanong dito. So sa board exam, walang word na except na nailagay. Pero ang sagot dito is letter C, moody, silent, and pouting behavior. Kasi letter A, letter B, and letter D are signs and symptoms that you will expect to see in a patient or in a child with attention deficit hyperactivity disorder. Kasi nga ang ating three key behaviors or hallmark sign ng ADHD ay inattentiveness, hyperactivity, at saka impulsivity. So letter C ang hindi kasali dito. And next, for question number 16, a child is taking Pemolin or Cylert for ADHD. The nurse must be aware of which of the following side effects? A. Decreased thyroid stimulating hormone. B. Decreased red blood cell count. C. Elevated white blood cell count, or letter D. Elevated liver function test. So itong Cylert or Pemolin, this is a form of central nervous system stimulant that is used to treat your ADHD. So the serious side effect in using your Cylert includes the life-threatening liver failure. So Pemolin is considered as hepatotoxic drug. So here in question number 16, the nurse must be aware of which of the following side effects. The correct answer here is letter D, elevated liver function test, because Cylert or Pemolin is considered as hepatotoxic drug. So letter D is the correct answer here. Then next, for question number 17, what are the three types of symptoms for attention deficit hyperactivity disorder? So kakasabi lang po natin yan kanina. A. Hyperactivity, impulsivity, inattention. B. Inattention, distraction, hyperactivity. C. Inattention, impulsivity, distraction. Or D. Hypervigilance, increase startle, and distraction. Again, ulitin ko. Pag sinabi po nating ADHD, the three key behaviors or hallmark sign of your ADHD are the EHI mnemonics. Ano bang EHI mnemonics? Inattentiveness, hyperactivity, and impulsivity. So, hyperactivity, impulsivity, inattention, letter A is the correct answer for question number 17. So, ito pong tatlong ito ang pinaka-hallmark sign ng ating ADHD. But in your preschool child, the most common symptom is your hyperactivity. Okay? So, A is the correct answer in your question number 17. Then next, for question number 18, a charge nurse is admitting a client who has a bipolar disorder and who is in the manic phase. Which of the following room assignments should the nurse give the client? A. A semi-private room across the day room. B. A private room across the nurse's station. C. A private room across the exercise room. Or D. A semi-private room across the snack area. So, keyword in your question number 18, yung patient natin may bipolar disorder tapos nasa manic phase po siya. So, kapag nasa manic phase po siya, i-avoid natin yung any stimulation. So, bawal po yung ma-stimulation sa kanya kasi lalo siya maging manic, okay? So, kailangan ang patient natin is ilagay natin sa private room. Pero, sa private room dapat? Is it across the nurse's station or is it across from the exercise room? So, bawal natin siyang ilagay sa ating private room malapit sa exercise room. Kasi pag nakita nyo yung ating exercise room, baka dun po siya magiging manic lalo. So, the correct answer here is letter B. It should be a private room across the nurse's station. Okay, so B po ang tamang sagot dito. Then next, for question number 19, attention deficit hyperactivity disorder is characterized by not one of the following. So take note, not one of the following. Again, so the three key behaviors or hallmark sign of ADHD are inattention, hyperactivity, and impulsivity. So, meron tayo ditong mental retardation, overactivity, inattentiveness, at saka impulsiveness. Okay? So, alin dito ang hindi po characteristic ng ADHD? So, very obvious po ang sagot natin. Letter A is the correct answer here. So, mental retardation is not one of the characteristic of your ADHD. So, letter A is the correct answer here. Kasi yung letter B, letter C, and letter D, these are the key behaviors of your ADHD. And for question number 20, apply multidisciplinary approach for patient care. Which among the members of the multidisciplinary team that the nurse would most likely collaborate with when the patient is at risk of fall due to an impaired gait? A. Podiatrist, B. Physical therapist, C. Speech therapist, or D. Nutritionist. Okay, keyword, the patient is at risk of fall due to an impaired gait. So, tanggal na dito yung ating nutritionist at tanggal na rin dito yung ating speech therapist. Okay? Kasi gait po ang ating problem dito, impaired gait. So, A or B po ba ang sagot natin dito? So, take note, ang podiatrist po ay isa pong specialized individual sa mga problem sa foot. Okay? Example, yung mga calluses, mga ingrown toenails. So, sila po yun. So, mali din ang ating letter A. So, the correct answer here is physical therapist po yan. So, yan po ay meron na po akong nagawang video lecture about dyan sa ating collaboration sa ating multidisciplinary team. At kung hindi mo pa po napapanood yung ating video na yon, ilalagay ko pa sa aking description box sa baba yung link ng video na yon at papanoorin nyo po yan mamaya after ng ating rationalization. Okay? So, the correct answer here in question number 20 is letter B, physical therapist po yan. Then next, for question number 21, which among the members of the multidisciplinary team that the nurse best to collaborate with when the patient can benefit the use of leg prosthesis? A. Occupational therapist, B. Physical therapist, C. Podiatrist, or D. Pharmacist. Okay, so elimination technique, tanggal agad yung ating pharmacist. Kasi ang pharmacist, specialized po yan sa mga gamot. Tanggal din ang letter C kasi specialized po yan sa mga diseases or disorders sa paa or sa foot like your calluses and your ingrown toenails. So between A or letter B, the correct answer here is occupational therapist. Kasi po, pag sinabi natin occupational therapist, sila po yung mag-explain kung ano yung mga benefit na makukuha natin sa ating mga devices like yung mga prosthesis at mga eating aids natin. So, sila din po yung magtuturo kung paano po siya gamitin at kung paano natin siya i-adapt sa ating activities of daily living. So, the correct answer here is occupational therapist. Okay? So, occupational therapist is the correct answer for question number 21. Okay, so next, question number 22. Which among the member of the multidisciplinary team that you would mostly likely collaborate with when the client can benefit from the use of adaptive devices for cutting food? A. Physical therapist, B. Occupational therapist, C. Dietitian, or D. Podiatrist. Okay, so keyword, the client can benefit from the use of adaptive devices for cutting food. So, try natin mag-eliminate muna ng ating options sa ating question number 22. So, una natin tatanggalin dito yung podiatrist. Kasi pag sinabi natin podiatrist, that is the specialist which is responsible for your foot disorders. So, mali pong ating letter D. Next na tatanggalin natin dito is letter C, dietitian. Kasi pag sinabi naman natin dietitian, siya naman po yung ating i-collaborate kapag meron pong kinalaman yun sa diet ng pasyente. Specific type of diet ng patient like your regular diet or mga therapeutic diets po yan. So, between your letter A and letter B, the correct answer here is letter B, occupational therapist pa rin po yan. Okay? Kasi pag sinabi po natin physical therapist is related to the interventions which are related to patient functional abilities. So, in terms naman po yan sa gait, strength, mobility, balance, coordination, and joint range of motion ng patient natin. So, the correct answer here is occupational therapist kasi siya po ang magtuturo kung paano po gamitin yung mga assistive aids na yan or mga adaptive devices like your prosthesis, like mga eating aids, mga leg braces, siya po yung merong kinalaman dyan. So, letter B is the correct answer, occupational therapist po yan. Then next, for question number 23, the stages of conflict and conflict resolution in the correct sequential order are 1. Conceptualization, 2. Prostration, 3. Resolution, or 4. Taking action. So, what is the correct sequential order of your stages of conflict and conflict resolution? Okay? So, take note na una po lagi dyan yung frustration. Okay? So, frustration first bago natin ma-conceptualize na meron tayong conflict na nagaganap. So, frustration followed by conceptualization, then followed by your taking action, and last is the resolution. Again, frustration, conceptualization, taking action, then last is the resolution. So, the correct answer here is letter B. 2, 1, 4, 3. Okay? So, letter B is the correct answer for your question number 23. So, the correct sequence for your conflict resolution is frustration, followed by conceptualization, taking action, then last is your resolution. So, letter B is the correct answer here. Then next, question number 24. Miss Josa, a young female patient, believes that doorknobs are contaminated with COVID-19 and refuses to touch them except with the aid of tissue paper. Signs such as using tissues to doorknobs develop because the patient is A. Unconsciously controlling unacceptable impulses or feelings. B. Listening to the voices that tell her that doorknobs are unclean. C. Consciously using this method of punishing herself. Or D. Fulfilling a need to punish others procedure by carrying out annoying. Okay? So, meron po tayo ditong patient with OCD, Obsessive Compulsive Disorder. So, that is a sign of your ritualistic behavior kasi meron po siya ditong pinapakitang compulsion, okay? So, yung obsession thoughts niya, nagiging compulsive behavior niya. So, such using tissue paper to handle your doorknob is a sign of your compulsive behavior. So, because of your obsessive thoughts, that is to relieve her anxiety. So, the correct answer here is letter A. Ginagawa po niya yan para makontrol po niya yung kanyang thoughts or feelings para ma-decrease or ma-reduce niya yung level of anxiety niya. So, letter A is the correct answer here. Okay, the next question number 25. Marlene, 74 years old, comorbid with hypertension and asthma, died of COVID-19. Daniel grieved and mourned to the loss of his mother's untimely death. He is now aware that his mother is one of those reported COVID deaths, and the nurse will consider the stage of grieving process Daniel experiencing is A. Depression, B. Bargaining, C. Denial and anger, or D. Acceptance. Okay, so number 25, ang keyword po natin dito, he is now aware that his mother is one of those reported COVID deaths. So remember nurses that pagdating sa ating board exam about your grieving process, isa sa pinakasikat na sigurong lumalabas lagi dyan is si Kubler-Ross 5 stages of grieving. So we have our DABDA mnemonics kung alam nyo po yan. So DABDA is the denial, anger, bargaining, depression, and acceptance. So each stage may pinagdadaanan po yung taong nagkaroon ng loss. Okay? So number 1 is the denial. So denial is the initial response of the individual and the family. So hindi lang po yung pasyente or yung taong may sakit, pati na yung family na iniwan ng kanilang mahal sa buhay. So that is the initial response that serves as a defense mechanism of the individual or the family to deny or to refuse the truth, okay, of the loss, okay? Then stage number 2 is your anger. Okay, so anger is the next stage in your DABDA process. So ang anger naman, these are the generalized feeling of rage and resentment. Okay, so common na mararamdaman ng patient natin dito yung ating anger and rage. So the patient here or the individual will say, why me? Okay, so why me? It's not fair. How can this happen to me? Who is to blame? So ayan na galit na yung patient. So, why me? It's not fair. How can this happen to me? Who is to blame? Yan ang pwedeng sabihin ng patient or ng individual na nagdadaan sa ating loss or grieving process. Okay? So, that is your anger. That is the number 2 stage of your Kubler-Ross stages of grieving process. Then, in your next stage is the bargaining stage. Pag sinabi natin bargaining, the person here will barter with doctors, family, and even God. Okay? So, nakikipagkalakaran na siya kaya doctor, kay family, or even God. Sasabihin niya dito, just let me live. I'll do anything for a few more years. Or sasabihin niya, I will give my life saving if. Or sasabihin niya, buhayin mo lang ako, pagalingin mo lang ako, tanggalin mo lang yung pain na nararamdaman ko, magpapakabait na ako pag ako'y gumaling dito. That is your bargaining process of your DABDA. And pag sinabi naman natin depression, depression is the stage where the person begins to understand the certainty of death. Because of this, the individual may become silent, refuse to accept visitors, and spend much of the time crying and grieving. So, lagi siyang umiiyak. So, ini-spend niya yung kanyang time sa pag-iyak at pagluluksa. So, sasabihin niya dito, I am going to die. So, pag sinabi niya, I am going to die, nasa depression stage po yan ng Kubler-Ross. Or, sasabihin niya, what's the point of living? I miss my loved one. Why go on? Sasabihin niya ganyan. So, miss ko ng aking mahal sa buhay. Bakit pa ba ako nabubuhay? So, that's your depression. Okay? So, I'm going to die. That is your depression stage. And the last stage of your Kubler-Ross stages of grieving is acceptance stage. It is the period of calm and peace, reflectance, awareness of the loss, and embracing the end of the battle. So, pag-accept na ng individual na tapos na yung laban or nagkaroon na siya ng awareness na wala na yung kanyang mahal sa buhay, that is under now the period of your acceptance. So, these are the 5 stages of grieving process by Kubler-Ross. We have your DABDA mnemonics, denial, anger, bargaining, depression, and acceptance. So, i-memorize nyo po ito, tandaan nyo po lagi itong DABDA natin kasi possible ulit yan nalalabas sa board exam kasi nga meron tayong COVID pandemic at common po dito yung mga loss and grieving process. Okay? So, we have our DABDA for question number 25. So sabi dito, he is now aware that his mother is one of those reported COVID deaths. So the person here, Daniel now here is under your acceptance stage. So letter D is the correct answer for question number 25. Okay, so hindi natin pwedeng ilagay yung ating depression kasi wala naman dyan nakalagay na umiiyak siya at nag-grieve lang po siya lagi. So that is the acceptance stage. Letter D is the correct answer in your question number 25. It's your acceptance kasi aware na po siya na wala na yung kanyang nanay. Then next, for question number 26, Shirley tells you that she can visibly see the virus that causes COVID-19 in her hands. This is A, delirium, B, hallucination, C, delusion, or D, illusion. Okay? So keyword in your question number 26, Shirley can visibly see the virus. Okay? Visibly see the virus. So take note, ang mga viruses natin, ang mga microorganism, can't be seen by your naked eye. So hindi po siya makikita by naked eye. So pag nakikita mo yung virus with your naked eye, you are having what? A, delirium, hallucination, delusion, or illusion. So ano po nga sasagot natin dyan, okay? So para mas maintindihan po natin ang mga ito, kailangan i-define natin ang ibig sabihin ng bawat isa. So number 1, we have a delirium. Pag sinabi po natin delirium, it is a disturbances in your mental awareness or cognition that develops over a short period of time, which is abrupt po yung onset kapag delirium, okay? At pag sinabi naman po nating hallucination, it is a false perception without the presence of stimuli. So there's a false fixed sensory experiences. So example dyan, mga visual hallucination, auditory hallucination, tactile hallucination, etc. Okay? So walang stimuli. So may nakikita na wala tayong nakikita or wala namang object siyang nakikita. Okay? At meron siyang naririnig na wala naman tayo naririnig. That is your hallucination. Pag sinabi naman natin delusion, delusion is a false fixed belief or idea or thought and there is no sensory component. Wala pong sensory component kapag ito ay delusion. Mga false fixed beliefs, idea or thoughts lang po yan. So example is your delusion of grandeur, delusion of your persecution, we have your delusion of your reference or idea of reference. So yung mga yun, so delusion po yun. Okay? And pag sinabi naman natin illusion, illusion is a misinterpretation of reality, a sensory experience with the presence of stimuli. So, dito sa illusion naman natin, there is a referent or something that is actually existing but they misinterpret it. So, iba yung pananaw nila or paningin nila sa isang bagay na yon. So, that is your illusion. Example, sa ating illusion, yung cord ng electric fan, ang tingin ng patient is nagiging snake or yung kanyang IV line nagiging snake or ahas. So, that is your illusion. Okay? So, again, so that is your delirium, hallucination, delusion, and your illusion. Sa hallucination, no stimuli. Sa ating delusion, false fixed beliefs, thoughts, and your mga beliefs, thoughts. And pag sinabi naman natin illusion, there is the presence of your stimuli. So dito, nakikita daw niya yung virus na nagkukos ng COVID-19. So wala namang stimuli na sinabi, so that is your hallucination. So nangyari sa kanya is your visual hallucination. So the correct answer here is hallucination. So the correct answer here is letter B, hallucination. Kasi nga, hindi naman natin pwede makita yung ating virus with our naked eyes. Then next, for question number 27, you observe Alma, a patient diagnosed with OCD, to be repeatedly washing her hands due to the fear of getting the COVID-19 virus. One night, you interrupted her from her hand-washing ritual and attempted to escort her to her room. She slapped you. The most probable reason for Alma's behavior is her A. Hate of hospital regulations such as bedtime. B. Ritual of hand washing is usually followed by aggressive behavior. Or C. Experience of severe anxiety because you stop her from what she is doing. Or letter D. Dislike of you as her nurse. So, sinampal ka daw ni Alma, okay? Kasi pinigilan mo siya sa kanyang pag-hand washing, okay? So, the most probable reason for Alma's behavior is her letter C. Experience of severe anxiety because you stop her from what she is doing. So, take note, kapag ang patient is may OCD, common po sa kanila yung ating obsessive thoughts. So, by their obsessive thoughts, dinidischarge po nila yan by compulsion. And yung compulsion na yon ay namamanifest po by ritualistic behavior like her hand washing. So, kaya nasampal si nurse dito kasi pinigilan niya si Alma sa kanyang ritualistic behavior. Eh, sabi na natin kanina, yung ritualistic behavior na yan ay means ng mga OCD para malesen yung level of their anxiety. So, the correct answer here is letter C. Then next, for question number 28, when human needs are taken away or not met for some reason, a person experiences loss. Using Maslow's hierarchy of human needs, which one of the following will the nurse consider a loss in case of death? A. loss of security and sense of belonging, B, loss related to self-actualization, C, physiologic and safety loss, or D, loss of self-esteem. So dito sa ating types of loss, meron na po akong nagawang content video sa aking channel about your types of loss. So pwede nyo po siyang tingnan ulit mamaya sa ating description sa baba. Okay? And panoorin nyo yan after ang ating rationalization para mas maintindihan nyo po ito. Okay? So dito anong klase daw yung loss na in case of death of a person? Okay? So una, mag-eliminate muna tayo dito ng ating option. So una natin tatanggalin tong physiologic and safety loss. Kasi pag physiologic, yung mga examples natin dyan ay yung mga nag-undergo ng mga amputation, mastectomy, hysterectomy, and yung mga nagkaroon ng immobility. At kapag sinabi naman nating safety loss, ito naman yung mga violence, mga public violence, domestic violence, child abuse. So walang nangyaring mga ganun dyan sa ating situation. So tanggal yung ating letter C. Then next nating eliminate dito is yung ating letter B, the loss related to self-actualization. Kasi ang example ng ating loss related to self-actualization is kapag yung person is want to accomplish something tapos hindi niya po yung tinapos or hindi niya ginawa kasi na-realize niya na hindi rin yung magiging materialize, that is a loss related to self-actualization. So, between letter A and letter D, the correct answer here is letter A. The loss of security and a sense of belonging. Kasi under ng loss of security and sense of belonging, nandyan yung marriage, divorce, nandyan yung illnesses, and the death of your loved ones. So letter A is the correct answer for your question number 28. Then next, for question number 29, a client has just been informed of diagnosis of severe COVID. The client states, God has to have mercy on me because of my children need me. He knows I'll change if he gets me through this. The nurse documents that the wife is expressing signs of which Kubler-Ross stages of grief? A. Denial, B. Anger, C. Bargaining, or D. Depression. Okay, so keyword, sabi dito, God has to have mercy on me because my children need me. He knows I'll change if he gets me through this. Doon pa lang, he knows I'll change if he gets me through this, there's a bartering. So, pinapakita dito sa ating situation sa number 29 na yung nanay or yung ating patient dito is nag-undergo po siya ng bargaining stage of your Kubler-Ross stage of grief. Kasi nga, merong bartering na nagaganap. Okay? So, the correct answer here is letter C. Bargaining is the correct answer here. Okay, the next question number 30. As a nurse, which of the following are the critical factors for successful integration of loss during the grieving process? A. The patient's predictable and steady movement from one stage of the process to the next. B. Accurate assessment and intervention by the nurse or helping person. Or C. The nurse trustworthiness and healthy attitude about grief. Or letter D. The patient's adequate perception, adequate support, and adequate coping. So, alin po dito yung ating critical factor for successful integration of loss during the grieving process? So, eliminate your letter C and letter B. So, hindi po yan yung ating critical factor for successful integration for loss during grieving process. Kasi pag sinabi natin grieve, that is a response to a loss. So, A or D? So, the correct answer here is letter A. Okay? It is the patient's predictable and steady movement from one stage of the process to the next stage of the process. Kasi pag sinabi natin grieving process, dapat dadaan yung patient natin sa ating DABDA. Okay, denial, anger, bargaining, depression, then acceptance. So letter A is the correct answer in your question number 30. Okay, the next question number 31. Which of the following statements should Nurse Mara consider as true with anorexia nervosa? A. Thinness is equated with vanity among peers. B. Eating disorders are not major health problems. C. Cultures linking beauty to thinness increases the risk of the illness. Or D. Anorexia nervosa is not considered as a mental disorder. So take note sa ating question number 31. Ang hinahanap po natin dito is the true statement about your anorexia nervosa. So what is anorexia nervosa? So if we say anorexia nervosa is an eating disorder involving a psychological loss or denial of appetite followed by self-starvation related in a part to a distorted body image and to various social pressure commonly associated with puberty. So take note that your anorexia nervosa is an eating disorder. So ito po ay considered as a mental health problem or a mental illness. So it is an eating disorder. It is the anorexia nervosa. So aside to our physical examination, we have also your BMI that helps to measure and detect the severity of your anorexia nervosa. So alam naman po natin na ang ating normal BMI by your WHO criteria is 18.5 to 24.9 sa ating WHO criteria, while on your Asian criteria, it is 18.5 to 22.9. Okay? So, pag meron kang anorexia nervosa, ang mga degrees po nito ay nasa mild, moderate, severe, tsaka extreme. So, the anorexia nervosa is classified as mild if the BMI score is more than or equal to 17. And moderate naman kapag ito ay nasa 16 to 16.99 BMI. And severe anorexia nervosa na kapag ang BMI niya is nasa 15 to 15.99, and extreme anorexia nervosa na kapag ang kanyang BMI score is less than 15 na. Okay? So, these are the classification of your anorexia nervosa: mild, moderate, severe, and extreme. So, remember nurses that there are two types of your anorexia nervosa. We have a restricting type and the binge eating or the purging type of anorexia nervosa. So, pag sinabi po nating restricting type, a person here restricts their food intake on their own without engaging in binge eating or purging. While in your binge eating or purging, a person here self-induces vomiting for the purpose of your weight loss or abuses laxatives and diuretics, leading to cardiac arrhythmias and your hypokalemia na naging cause of death po nila. Okay? So, we have two types of anorexia nervosa. We have a restricting type and the binge eating or purging type of anorexia nervosa. So, we have your risk factors for anorexia nervosa. Number 1 is female. So, pagiging babae, kasi 90 to 95% of all cases are female, okay? And number 2, we have your young age because your anorexia nervosa is noted during your pubertal stage. And number 3, genetics or family history. So, those with a first-degree relative are more susceptible. So, kapag meron po sila mga first-degree relative na merong anorexia nervosa, so at risk din po sila na magkaroon ng anorexia nervosa. And number 4, weight changes. Kung pabago-bago po yung kanilang weight, when people change weight, it may be reinforced by a positive or negative comments from others which affects the way someone sees themselves. So, nakadepende din po yan kung paano po sila tingnan ng ibang tao. And number 5, transition. So, changes from normal routine like new school, job, relationship, or death of loved one. And number 6, we have your sports, work, and artistic activities like being athletes and actors like dancers, models. So, sila po yung pinaka-high risk due to your social pressures, okay? And number 7, media and your society. So, kapag ikaw ay may napanood sa TV, fashion magazines, and social media, okay? So, yun po yung mga risk factors ng ating anorexia nervosa. So, what are the warning signs of anorexia nervosa? Number 1, we have our dramatic weight loss, okay? Dramatic weight loss, followed by number 2, preoccupation with weight, with food, with calories, etc. na may kinalaman sa pagkain. And number 3, refusal to eat certain foods and restricting whole categories of foods. And number 4, frequent comments about being fat. So, tinitingnan nila yung sarili na mataba kahit hindi naman sila mataba. And number 5, anxiety about gaining weight. Takot silang mag-gain ng weight. So, ngayon, minemaintain nila yung kanilang pananaw sa kanilang sarili na sila ay mataba. Kaya ang ginagawa nila is nagpapapayat po sila. And number 6, denial of hunger. And number 7, food rituals. And number 8, excuses to avoid mealtime. Number 9, withdrawal from friends. Number 10, excessive exercise, okay? And number 11, wearing your loose clothing. So, nagwe-wear po sila ng mga layers of your loose clothings para magmukha po silang malaki, okay? So, that's your number 11. Wearing loose clothing is a common board question. Also, your excessive exercise. So, these are the warning signs of anorexia nervosa. Okay? So, nandyan po yung dramatic weight loss, etc. Okay? So, what are the physical symptoms of anorexia nervosa? Number 1, extreme weight loss. Ano pa? Thin appearance with your growth of your lanugo. And number 3, abnormal blood counts. Number 4, fatigue or insomnia. Number 5, dizziness or fainting. Number 6, bluish discoloration of fingers. Number 7, hair that thins falls out. So, hair are thins. Number 8, amenorrhea or no menstruation. And number 9, constipation po, hindi diarrhea. And number 10, yellowish dry skin. And number 11, intolerance of cold. Number 12, osteoporosis. And number 13, swelling of the face. Okay? So, yun po yung mga physical symptoms na merong anorexia nervosa. Okay? So, yun po yung mga extreme weight loss, thin appearance, may lanugo sa skin. Ano pa? Meron tayong brittle hair, amenorrhea, constipation, and intolerance of cold. So, some emotional symptoms of anorexia nervosa also includes your number 1, preoccupation with food. Number 2, refusal to eat kasi ayaw nilang tumaba, ayaw nilang mag-gain ng weight. Number 3, denial of hunger. Number 4, lying about what they have eaten. Number 5, social withdrawal kasi nahiya sila. And number 6, irritability. Number 7, reduced interest in sex. And number 8, depressed mood. Okay, so yun po yung ating mga emotional symptoms of anorexia nervosa. So, what will be the dietary implication for anorexia nervosa? Number 1, tell them to avoid caffeine, avoid alcohol and tobacco kasi itong mga ito nakaka-dehydrate po ng skin, okay? Especially yung caffeine and alcohol. And number 2, drink 6 to 8 glasses of water a day to maintain hydration status. And number 3, use quality protein sources like your eggs, meats, and whey. Kasi nga, bumabagsak din po yung kanilang serum albumin kaya nagkakaroon po sila ng mga swelling sa kanilang part of the body. And number 4, avoid refined sugars. And number 5, supplements like your daily multivitamins and the use of omega-3 fatty acids. So now, balik tayo sa ating question number 31. Which of the following is true with anorexia nervosa? So, elimination technique, tanggal ang ating letter D kasi not considered as mental disorder daw ang anorexia nervosa. Mali kasi nga it is considered as a mental health problem kasi eating disorder po siya. So, mali ang ating letter D. Next na eliminate natin, letter B. Eating disorders are not major health problems. Mali din yun kasi take note, eating disorders are a major health problem also. So, mali ang B, mali ang D. So, A or C na lang ang natitira. So, between A or C, the correct answer here is letter C. Okay, so cultures linking beauty to thinness increases the risk of the illness. Kasi nowadays, maraming mga kabataan ngayon ang nawiwili sa mga personalities na mga payat at gusto nila yang gayahin. So, cultures and linking beauty to thinness increases the risk of the illnesses. So, letter C is the correct answer here. That is the true statement about your anorexia nervosa. So, A, B, D are incorrect statement about your anorexia nervosa. Then next, for question number 33, a teenager is being evaluated for an eating disorder. Which finding would suggest anorexia nervosa? A, guilt and shame about eating patterns. B, lack of knowledge about food and nutrition. C, refusal to talk about food-related topics. Or letter D, unrealistic perception of body size. Okay, so meron tayo ditong anorexia nervosa. So take note, pag sinabi nating anorexia nervosa, meron po silang unrealistic perception of their body size. So the correct answer here is letter D, unrealistic perception of body size. Kasi itong mga anorexia nervosa patient natin, ang pananaw nila sa sarili nila ay mataba na sila kahit payat pa sila, okay? So, ang ginagawa nila, nagda-diet po sila, nagvi-vigorous exercise po sila, which is mali po ang kanilang pananaw sa kanilang body size. So, letter D is the correct answer, unrealistic perception of body size po yan, okay? Then next, which is not a goal for treating the severely malnourished client with anorexia nervosa? Severely malnourished na yung patient natin. Not a goal ang tinatanong po dito. So, letter A, correction of body image disturbances. Letter B, correction of electrolyte imbalance. C, nutritional rehabilitation. Or D, weight restoration. Okay. So, tanggal una natin yung letter B kasi that is your priority goal. Correction of electrolyte imbalance. Okay. Lalo na nagkakaroon po dito ng ating fluid volume deficit at saka yung hypokalemia. So, letter C, tama din yan. Goal din natin yan. So, mali din yung ating letter C. Letter D, weight restoration, goal din natin yan. So, mali din ang ating letter D. So, ang hindi natin goal dito sa ngayon sa ating severely malnourished client is letter A, correction of body image disturbances. So, letter A is not a goal for treating the severely malnourished client with anorexia nervosa. Okay? So, letter B, letter C, and letter D kasi is goal natin sa kanya. Then next, for question number 35, which of the following is the initial goal for treating the severely malnourished patient with anorexia nervosa? Kung kanina is not goal, ngayon initial goal naman ang tanong at ito po yung lumabas sa board exam. So, A, nutritional rehabilitation. B, correction of body image disturbances. C, weight restoration. Or D, correction of electrolyte imbalance. So, take note, kapag meron po tayo ditong mga goal na initial goal, unahin natin yung physiologic needs ng patient natin. So, ang pinaka-physiologic need dito is your letter D, the correction of your electrolyte imbalance. Kasi nga, prone nga siya sa fluid volume deficit at saka sa ating electrolyte imbalance like your hypokalemia. So, letter D is the correct answer kasi pag hindi mo yung na-correct, meron po siyang health consequences. Pwedeng magkaroon ng cardiac arrhythmias at pwedeng mamatay po yung ating patient. And the number one complication of your anorexia nervosa is death. Okay? So, mamamatay po sila due to your cardiac arrhythmias and the presence of your electrolyte imbalance like your hypokalemia. Then next, for question number 36, Nurse Mara is working with Clara. Even though Clara has been eating all her meals and snacks, her weight has remained unchanged for 1 week. Which nursing intervention appropriate for Clara? A. Supervise Clara closely for 2 hours after meals and snack. B. Supervise Clara closely 2 hours before and after meals. C. Increase the daily caloric intake calories from 1,500 to 2,000. And letter D. Increase the daily caloric intake from 1,800 to 3,000 calories. So in your question number 36, the correct answer here is letter A. Supervise Clara closely for 2 hours after meals and snacks. Okay? So take note that intervention that should be implemented in your patient with your eating disorders includes sitting with the client during meals and snacks and observing the client following meals and snack. So 1 to 2 hours, and be alert for attempts to hide or discard food or to inflate their weight. Okay? So kailangan tayong maging alerto sa mga ginagawa nilang pag-hide ng mga pagkain or pagtatapon ng pagkain or nagsusuksok sila ng kung ano-ano mang bagay sa kanilang katawan para lang bumigat ang kanilang timbang, or nagsusot sila ng mga layers of your thick clothings or loose clothings para lang magbuka silang tumataba or para bumigat din ang kanilang timbang. So, sabi nga dito, so the patient should be observed 1 to 2 hours after your meals and snack. Okay? So, sitting with the client during meals and snacks and observing the client following meals and snack 1 to 2 hours. And be alert for attempts to hide or discard food or to inflate their weights. Okay? So, the correct answer here is letter A. Then next, for question number 37, Nurse Mara is doing an assessment to Clara with anorexia nervosa, would expect to find which of the following? Select all that apply. 1. Believe that dieting behavior is not a problem. 2. Feelings of guilt and shame about eating behavior. 3. History of dieting at a young age. 4. Performance of rituals or compulsive behavior. 5. Strong desire to get treatment. Or 6. View of self as overweight or obese. Okay? So, anorexia nervosa. Number 1, believe that his dieting behavior is not a problem. Tama po yan. So, isa po yan sa expect mo, makikita mo sa pasyenteng may anorexia nervosa. So, lahat na may mga number 1, tama po yan. So, except letter C, tanggal na po yung ating letter C. Next, number 2, feeling of guilt and shame about eating behavior. So, wala po sila niyan. So, feelings of guilt and shame about eating behavior. So, mali po yung mga may number 2. So, mali ang A, mali ang ating letter D. So, the correct answer now here is letter B kasi siya lang yung walang number 2. So, 1, 3, 4, 6 ang tamang sagot dito. Kasi, history of dieting at a young age. Kasi sabi natin, ang anorexia nervosa, nakikita po natin yan sa mga kabataan. Usually, nag-start po at puberty. Okay? So, performance of rituals or compulsive behavior, tama din po yan. Strong desire to get treatment, hindi. Okay? Kasi iba yung kanilang pananaw. Okay? So, distorted yung kanilang body image. So, the correct answer here is letter B, 1, 3, 4, and 6. Okay? So, letter B is the correct answer for question number 37. Then, next, question number 38. One morning, as Nurse Mara entered Clara's room, she noticed that the patient was engaging in a rigorous push-up. Which nursing action is most appropriate? A. Allows her to complete her exercise program. B. Tell her that she is not allowed to exercise rigorously. C. Interrupt her and offer to take her for a walk. Or letter D. Interrupt her and explain that exercise is not needed. So, which of the following nursing action is the most appropriate? So, take note, bawal po silang mag-perform ng mga rigorous push-up. So, pero hindi mo sila pwedeng i-interrupt tapos sabihan mo na mali yung ginagawa nila. So, ang gagawin natin dyan is letter C. Interrupt her and offer to take her for a walk. So, this is the most appropriate option in your question number 38. So, kapag nakita mo yung patient mo, nag-engage po siya ng rigorous push-up or any exercises, interrupt your patient and offer a walk with her. Okay? So, letter C is the correct answer here. Then next, for question number 39, bulimia is best defined as an A. Eating disorder associated with excessive vomiting. B. Disorder of unknown origin associated with starving oneself. Or C. Phobic disorder of fear of obesity. Or letter D. Pathological disorder of binging and vomiting. Okay, so B for bulimia and B for binging. Okay, so we have your letter D. Nagkakaroon po tayo dito ng binge eating and vomiting. So the correct answer here, the best definition of your bulimia here is letter D. It is a pathological disorder of binging and vomiting. So letter D is the correct answer. So take note, it is not a phobic disorder, but it is a an eating disorder. So, hindi po siya phobic disorder. Ito pa isang klase ng eating disorder. So, mali po ang ating letter C. So, the correct answer here is letter D, pathological disorder of binging and vomiting. So, bulimia nervosa is an eating disorder that is potentially life-threatening. So, it is defined as episodes of binge eating followed by inappropriate response behavior such as your self-induced vomiting, fasting, misuse of laxatives, diuretics or other medicines, or excessive exercises. Again, so it is defined as episodes of binge eating followed by inappropriate responses behaviors such as your self-induced vomiting, fasting, misuse of laxatives, misuse of diuretics or other medicines, and excessive exercises. Okay? So that is your bulimia nervosa. It is an eating disorder and it is not an phobic disorder. So eating disorder po siya. Then next, for question number 40, what condition is not likely to develop in bulimia? A. Dental erosion, B. Gastric ulcers, C. Rectal bleeding, or D. Hyperkalemia. So, not likely to develop in bulimia. So, dental erosion, possible po yan na mangyari sa kanya kasi nagva-vomit po siya. So, na-erode po yung enamel of the teeth. Okay? So, sa tuwing magva-vomit po siya, dumadaan yung gastric acid at na-erode po yung enamel ng kanyang ngipin. And letter B, gastric ulcer, ganon din po yun. So, nakaka-ulcer po yan kasi nagva-vomit din po siya. And letter C, rectal bleeding, possible din po yan because of your we have your misuse or the overuse of your laxatives. Okay, so possible din na magkaroon siya ng rectal bleeding. But in your letter D, hyperkalemia, mali kasi dapat hypokalemia ang ma-develop sa kanya at hindi hyperkalemia. So the correct answer here is letter D, hyperkalemia is not likely to develop in a patient with bulimia. Then next, question number 40, endocrine changes often results in bulimic patient. Which of the following would be an expected change in bulimia? A. Increased production of follicle-stimulating hormone. B. Delayed thyroid-stimulating hormone response to hormone replacement therapy. Or C. Decreased adrenocorticotropic hormone in response to cortisone. Or D. Hypopituitarism. Okay, so alin daw dito yung endocrine changes associated with a change in bulimia? So the correct answer here is letter B. Delayed thyroid-stimulating hormone response to hormone replacement therapy. So this is the most common associated endocrine changes in your bulimic patient. So letter B is the correct answer. Delayed thyroid stimulating hormone response to hormone replacement therapy. So delayed po ang kanyang TSH response to hormone replacement therapy. So the correct answer here is letter B. Then next, question number 42. Bea with bulimia is learning to use the technique of self-monitoring. So, which of the following interventions by the nurse would be most beneficial for this client? A. Ask the client to write about all feelings and experiences related to food. B. Assist the client to make out daily meal plans for 1 week. C. Encourage the client to ignore feelings and impulses related to food. Or letter D. Teach the client about nutrition content and calories of various foods. So take note, nurses, that if we say self-monitoring is an example of your cognitive behavioral technique in your cognitive behavioral therapy. So lumalabas din po yan sa board exam. So example of your cognitive behavioral technique is your self-monitoring. So lumalabas din po yon sa board exam. So which of the following is the most beneficial for this client? So the most beneficial here for your self-monitoring is letter A. Ask the client to write about all feelings and experiences related to food. So A po ang sagot natin dyan, and that is a common board question. Then next, for question number 43, the nurse is evaluating the progress of a client with bulimia. Which of the following behaviors would indicate that the client is making positive progress? So positive progress pang hinanap natin dito. A. The client can identify calorie content for each meal. B. The client identifies healthy ways of coping with anxiety. C. The client spends time resting in her room after meals. Or letter D. The client verbalizes knowledge of former eating patterns as unhealthy. Okay? So, which of the following will indicate a positive progress? So, mali po yung ating letter C kasi nag-spend po siya ng resting time in room after meals. Mali po yun. So, hindi natin alam kung ano ginagawa niya dun sa room niya. Baka mamaya nagpe-purging na naman siya or nagva-vomit na naman po siya. So, mali po ang ating letter C. So, between A, B, and D, the correct answer here is letter B. The client will identify healthy ways of coping with anxiety. Okay? So, healthy ways of coping with anxiety makes a positive progress in a patient with bulimic disorder. Okay? So, letter B is the correct answer here. Okay, the next question number 44, treating clients with anorexia nervosa with SSRI, antidepressants such as fluoxetine or Prozac may present which of the following problems? A. Clients object to the side effect of weight gain. B. Fluoxetine can cause appetite suppression and weight loss. Or C. Fluoxetine can cause clients to become giddy and silly. Or D. Clients with anorexia get no benefit from fluoxetine. So, mali po ang ating letter D kasi may benefit po yung patient natin sa ating fluoxetine or Prozac. Okay? So, ang mali lang dito is yung ating problem lang dito is yung letter B. Okay? Because fluoxetine can also cause appetite suppression and weight loss. Yung patient natin is meron ng anorexia nervosa. So, the use of your SSRI antidepressant fluoxetine Prozac may result into a weight loss or appetite suppression. So, yun po ang ating magiging problem dito. So, letter B is the correct answer for question number 44. Then next, for question number 45, the client comes to the nurse's station at 3 o'clock a.m. demanding that the nurse call the provider immediately. What would be your most therapeutic response to a manic patient demanding that you call his attending physician to make an order for a pass to go out at the middle of the night? A. You go to the recreation hall now while I call your attending physician. B. You must really be upset to want a pass immediately. I will give you a medication to make you calm. C. I can't call your physician now but you can talk to me about your request to pass. Or letter D, don't be unreasonable. I can't call your attending physician in the middle of the night. So, which of the following here is the most therapeutic response? So, in your question number 45, the most therapeutic response into a manic patient who wants to go out at night or at 3 o'clock a.m. is letter B. So, we must acknowledge the feeling of your patient. Okay, so letter B is the most therapeutic here. You must really be upset to want a pass immediately. I will give you a medication to make you calm. So this is the most therapeutic response for your manic patient. So letter B is the correct answer in your question number 45. So this is a common board question. So take note and remember the correct answer here. It's letter B. Paulit-ulit po yan na lumalabas basta bipolar manic disorder po yung ating tanong. Then next, question number 46. During lunchtime, you have observed that a patient with mania taking food from other patient. What principle would guide you in determining the appropriate intervention in this situation? A. The patient needs food and fluids any way possible. B. The patient will calm down as soon as lunchtime is over. Or C. The intrusive behavior of manic patient is not a threat to other patient. Or letter D. Other patients need to be protected from the intrusive behavior of other patients. So, mali dito ang ating letter C kasi sabi dito, not a threat to others daw ang intrusive behavior ng manic patient. So, mali po yun. There's a threat to other patient po. So, always provide safety to the patient and to the other clients. Okay? So, the correct answer here is letter D. Okay? So, other patient need to be protected from intrusive behavior of other patient. So, this is the most appropriate principle that will determine your appropriate intervention in this situation. So, letter D is the correct answer. Other patient need to be protected from the intrusive behavior of other patient, especially kapag ito ay manic patient. Okay, then next, question number 47. A patient is manifesting some manic depression. So, which of the following activities would you provide to distract such patient? A. You let the patient go for walk. B. Let him watch the final game of UAAP. C. Give him a book. Or D. Let him play checkers with another patient. So, manic depression po yung ating pasyente dito. So, mag-eliminate muna tayo dito. So, letter B and letter D are eliminated kasi possible dyan na magkaroon ng pagtatalo. So, bawal po yan sa ating patient with manic or depression. So, B or D is not appropriate here. Okay? So, between letter A and letter C, madami po lagi nagkakamali sa board exam kapag lumabas po itong tanong na ito kasi ang sinasagot po nila is letter A. So, take note that letter A is inappropriate here for your patient with manic depression. You let the patient go for a walk. So, hinayaan mo lang siyang mag-isang maglakad. So, mali po yun. So, mas therapeutic po sana ang letter A kapag you walk with the patient. With the patient po dapat, not your patient alone. Okay? So, you let the patient to go for a walk means you let your patient to walk alone. So, mali po ang ating letter A. So, the best and the most appropriate here is letter C. Give him a book. Okay? Kasi manic depression po yan, hindi po natin siya pwedeng hayaan na mag-isa. Okay? So, never let your patient to go for a walk alone. You should go with your patient to walk. Okay? So, you should go with your patient to walk. That is the most therapeutic sana. Kaso nga lang, wala yan sa choices. So, the correct answer here is letter C. Give your patient a book. Then next, for question number 48, what therapeutic activity would you provide patient with mania? A. Doing ceramics and whittling. B. Playing cards and checkers. C. Playing bingo and knitting, or letter D. Drawing and folding towels. Okay? So, therapeutic activity pong tinatanong natin. Ang patient natin is may mania. So, tanggalin muna natin ang ating letter B at letter C kasi competitive po ito. May pagtatalong pwedeng maganap. So, mali ang playing cards, mali po ang checkers, mali po ang playing bingo. B and C are eliminated here. So, between A or D, the most therapeutic activity here is drawing and folding towels. Okay? Drawing and folding towels. Kung walang drawing, pwede din po yung painting natin. Okay? Painting is also a therapeutic activity for a patient with mania. Mali ang ating letter A na drawing your ceramics. Okay sana yung ceramics, kaso nga lang, ceramic po yan. So, pwede na kapag natuyo yung ceramic is maging matulis po yung pag nabasag. And yung whittling is pointed sharp object po natin yan. So, mali po yung ating whittling. So, yun po nagpamali lalo sa ating letter A. Kasi yung whittling natin, gumagamit po tayo dyan ng sharp object. So, kasi pag sinabi mong whittling, nagki-curve ka po dito ng mga kahoy. Okay? So, curving po kasi ang ibig sabihin ng whittling natin. And yung ceramics, kapag natuyo po yung ceramic natin, pag nabasag, pwede maging sharp object po yan. So, mali po ang ating letter A. So, the correct answer here is letter D. We have your drawing or painting and folding towels po yan. Okay? So, this is the most therapeutic activity for your patient with mania. And next, for question number 49, which of the following marks the initial phase of schizophrenia? A. Increased energy and motivation. B. Impaired role functioning and neglect of personal hygiene. C. Heightened work performance. Or D. Increased social interaction. So, take note, nurses, that schizophrenia barely affects 1% of the population. So, we have your three phases of schizophrenia. We have your prodromal, active, and the residual phase of schizophrenia. Number 1 phase is the prodromal phase. So, this early stage is often not recognized until after the illness has progressed. And number 2 is the active phase of your schizophrenia, which is also known as the acute schizophrenia. And this phase is the most visible. So, people here with schizophrenia will show the telltale symptoms of psychosis, including your hallucinations, suspiciousness, and delusion. So, dito mo makikita yung mga telltale signs and symptoms of psychosis of your schizophrenia, like your hallucinations, suspiciousness, and delusions. While in your residual phase of your schizophrenia, it is the time when individuals with schizophrenia have fewer obvious symptoms. So the psychosis is muted, however, some symptoms are still present, especially yung mga nakita mo sa ating prodromal phase of your schizophrenia. Again, so we have your three phases of schizophrenia: prodromal, active, and residual phase. So prodromal as the earliest phase of your schizophrenia. So during the prodromal phase of schizophrenia, the first signs and symptoms here is depression-like. Okay? So depression-like signs and symptoms, which includes your withdrawal from social life or family activities, isolation of your patient, increased anxiety, difficulty concentrating or paying attention, lack of motivation, struggling to make decisions, changes to normal routine, forgetting or neglecting personal hygiene, sleep disturbances, and increased irritability. So, para pong may depression yung patient mo dito sa ating prodromal phase of schizophrenia. Yan yung tatandaan nyo. Kung ano yung signs and symptoms ng depression, makikita mo po yan sa ating prodromal phase of your schizophrenia. Especially yung forgetting or neglecting personal hygiene. The next phase of schizophrenia is the active schizophrenia. So, symptoms here are most obvious. So, example are the telltale signs and symptoms of schizophrenia, which includes your psychosis, like hallucination, paranoid delusions, confused and disorganized thoughts, disordered speech, changes to motor behavior, lack of eye contact, and your flat affect. So, yan na po ang mga common na makikita mong symptoms ng ating schizophrenia sa ating active phase of this condition. And during the residual phase or the last phase of your schizophrenia, symptoms resembles at early phase. So yung mga signs and symptoms na makikita mo dito ay parang nasa early phase ng ating condition or schizophrenia. So symptoms here of your residual phase of schizophrenia are said to include lack of emotion, social withdrawal like in your early phase, constant low energy levels, eccentric behavior, illogical thinking, conceptual disorganization, and frank vocalization. So ito po yung makikita natin sa ating residual phase of your schizophrenia. So it resembles with your early signs and symptoms of your schizophrenia. So back to question number 49, which of the following marks the initial phase of schizophrenia? A, B, C, or D? So the correct answer here, initial phase is letter B. Impaired role functioning and neglect of personal hygiene. So letter B is the correct answer in your question number 49. Boy po yan, okay? And next, for question number 50, which of the following methods can reduce the intensity of auditory hallucination? So, take note that auditory hallucination is the most common type or form of hallucination among your schizophrenic patient. So, A, talking to the patient, B, giving the patient amitriptyline, or C, advising the patient not to pay attention to the voices, or D, encouraging the patient to read. So, the correct answer here is letter A, talking to the patient. Okay, so mali po ang ating letter C, advising the patient not to pay attention to voices. Mali po yun. So, kailangan alamin din natin kung ano yung sinasabi ng voices sa kanya. Baka naman meron na siyang command hallucination at nagutos na po yun na mag-harm po siya sa sarili niya or i-harm po niya yung others. Okay? So, for safety of the patient and safety of everybody, so you must ask the patient what are those voicing telling to him. Okay? So, the correct answer here is letter A, talking to the patient to reduce the intensity and the occurrence of your auditory hallucination. So, A is the correct answer here. Okay, so next, question number 51. A COVID patient is admitted to the emergency department of the hospital from home with reports of chest discomfort and shortness of breath. She is placed on oxygen, has labs and blood gases drawn, and is given an electrocardiogram and breathing treatments. What level of preventive care is patient receiving? A, primary prevention, B, secondary prevention, C, tertiary prevention, or D, health promotion. So, keyword in our question number 51, the patient now is receiving treatments against COVID-19. So, pag meron ng treatment na nagaganap, that is now known as the secondary level of prevention. Kasi sa primary level of prevention, that is more on your health promotion and disease prevention activities pa lamang po tayo dyan. Pero pag meron ng treatment na nagaganap, that is now known as the secondary level of prevention. So, pag diagnosis, detection, and treatment, that is secondary level of prevention. And kapag sa tertiary prevention naman, that is more on rehabilitation. So, the correct answer here is letter B, secondary level of prevention po yan. Then next, question number 52. Clients with personality disorders have various self-defeating behaviors and interpersonal problems despite having near-normal ego functioning and intact reality testing. A nursing diagnosis that addresses this sort of interpersonal dysfunction is A, spiritual distress, B, defensive coping, C, impaired social interaction, or D, disturbed sensory perception. So, clients with personality disorders po ito. So, pag meron po tayong clients with personality disorders, common po sa kanilang manipulative behavior. Okay? So, pag meron po tayong mga manipulative behavior, so the most appropriate nursing diagnosis for them would be your impaired social interaction. So, letter C is the correct answer here, not your letter A, not letter B, and not letter D. Kasi wala namang disturbed sensory perception sa mga may personality disorders. Ang meron lang sa kanila is impaired social interaction because of their self-defeating behaviors and interpersonal problems. So, letter C is the correct answer here. Okay, then next, for question number 53, the priority nursing intervention for a client with borderline personality disorder is to A, protect other clients from manipulation, B, respect the client's need for social isolation, C, assess for suicidal and self-mutilating behaviors, or D, provide clear, consistent limits and boundaries. So take note, ang tinatanong po dito is the priority nursing intervention with your borderline personality disorder patient. So take note, nurses, that one of the primary nursing intervention for clients with personality disorder is to assess for suicidal and self-mutilating behaviors, especially kapag nasa time of stress po sila. So the correct answer in your question number 53 is letter C, assess for suicidal and self-mutilating behavior. So always prioritize your safety. So letter C is the correct answer for question number 53. Then next, for question number 54, a nurse is assigned to work with a client with borderline personality disorder. The nurse will need to consider strategies for dealing with the clients. A, mood shifts, impulsivity, and splitting. B. Grief, anger, and social isolation. C. Altered sensory perceptions and suspicion. Or letter D. Perfectionism and preoccupation with detail. Okay, so take note, borderline personality disorder. So common po sa kanila dito yung mood shifts, impulsivity, and splitting. So keyword is splitting is common in your borderline personality disorder. So the correct answer here is letter A. So remember nurses that if we say borderline personality disorder, it has a central characteristic of instability in affect, identity, and relationships. So borderline individuals desperately seek relationships to avoid feeling abandoned, but they often drive others away with excessive demands, impulsive behavior, or uncontrolled anger. So ayaw nilang maabandona pero pinapalayo naman nila yung tao sa kanila by means of excessive demands, impulsive behavior, and uncontrolled anger. And kung minsan nag-splitting po sila. So take note, kapag may borderline patient po tayo, common po sa kanila yung splitting. So mahilig po silang maglaro ng mga staffs or mga nurses that creates turmoil in healthcare setting. Okay? So pag ganun, wag kang bibigay. Okay? Don't give in to your splitting behavior of your patient kasi tayo ang talo doon. Okay? So kailangan na mapakita natin sa patient natin na hindi tayo basta-basta na napaglalaruan nila. So take note that splitting is common in your patient with borderline disorder. So the correct answer here is letter A. Then next, question number 55. Splitting is a process in which the client A. unconsciously represses undesirable aspect of self, B. places responsibility for his or her behavior outside the self, C. sees things as divided into all good or all bad, or letter D. evidences lack of personal boundaries. So alin dito yung ating splitting? So take note, splitting is common among your borderline patient. So take note nurses that if we say splitting, splitting demonstrates the failure to integrate the positive and negative into a cohesive whole. Okay? So an individual is not seen as a person with good and bad traits, but rather as all good or all bad. So yun pong paningin or pananaw ng ating patient na may personality disorder like your borderline personality. So it views the individual as all good or all bad. Yun pong ibig sabihin ng splitting. And take note, playing one staff member against another is an example of splitting defense mechanism of a patient with your borderline personality. So pinaglalaroan din nila minsan yung may staff or mga nurses sa unit. So in your number 55, the correct answer here is letter C. Splitting sees things as divided into all good or all bad. So letter C is the correct answer here. Then next, for question number 56, characteristic behaviors the nurse will assess in the narcissistic client are A. Dramatic expression of emotion, being easily led, B. Perfectionism and preoccupation with detail, or C. Grandiose, exploitive, and rage-filled behavior, or letter D. Angry, highly suspicious, aloof, and withdrawn behavior. So, alin po dito yung ating makikita sa patient na may narcissistic behavior? So, remember nurses that if we say narcissistic clients, it gives the impression of being invulnerable and superior to others to protect their fragile self-esteem. So, pag sinabi po nating narcissistic, yan po yung mga self-centered na individual na sobra-sobra ang kanilang paniniwala or ang kanilang tingin sa kanilang sariling kakayahan, sa kanilang sariling talento, or in short, sila yung sobra yung kanilang pananaw sa kanilang sarili. Dito mo makikita yung tinatawag natin na grandiosity. So, sobra-sobra ang kanilang paniniwala, ang kanilang belief sa kanilang sariling mga kakayahan. So, self-centered po sila. So, that is grandiosity. So, common dito yung exploitive and rage-filled behavior. So, the correct answer here is letter C. Okay? So, tandaan yan, grandiosity, grandiose behavior. So, letter C is the correct answer here. Then next, for question number 57, how is Alzheimer's disease diagnosed? A. Mental status test, B. Blood test, C. Neurological test, or D. All of the above. Okay, so take note, Alzheimer's disease can be diagnosed via mental status test, blood test, neurological test. So the correct answer here is all of the above. So letter D is the correct answer here. So remember nurses that Alzheimer's disease is the most common form of dementia and may contribute to 60 to 70% of cases. So dementia is a syndrome in which there is a deterioration in memory, thinking, behavior, and the ability to perform everyday activities. So in your dementia, it affects your memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment. So, consciousness in dementia is not affected. Tandaan niyo po yan. So, aphasia is the cardinal symptom observed in Alzheimer's disease. So, pag tanong ka sa board exam, kung ano po yung cardinal symptom ng Alzheimer's disease, your answer is aphasia. Okay? So, in your Alzheimer's disease also, it is a progressive neurologic disorder that causes the brain to shrink or atrophy and the brain cells to die. So, pag tanongin ka sa board exam, physiologically, what happens to the brain as Alzheimer's progresses? Your answer is the cell dies. Okay? So, cell dies is your answer in the board exam because Alzheimer's disease damages and kills the brain cells. Tandaan niyo po yan, okay? So, take note, nurses, that no single test identifies Alzheimer's disease. So, the lab test will help rule out the other disorders that may produce similar symptoms, while the neurological and mental status test will reveal cognitive function deficit in Alzheimer's disease. So, the correct answer here is all of the above. So, letter D is the correct answer here. Then next, for question number 58, which of these is the strongest risk factor for developing the disease? Alzheimer's disease po ang pinag-usapan natin dito. A. Heredity, B. Age, C. Exposure to toxins, or D. None of the above. Okay? So remember, nurses, that although some studies have shown an association between certain modifiable lifestyle factors and reduced risk of your Alzheimer's disease, the NIH says that age is the strongest known risk factor for your Alzheimer's disease, where most people receive the diagnosis of Alzheimer's disease after the age of 60. So, tandaan niyo po yan. So, karamihan naman na diagnose ng ating Alzheimer's disease is after the age of 60. And take note that the strongest risk factor here is your age. So, the correct answer here is letter B. Okay? And pagtanong ko sa board exam, which age group has the highest rate of Alzheimer's cases reported is 85 and older. Tandaan yan. So, more than 85 years old po ang pinaka-highest rate ng ating Alzheimer's cases reported. So, yung ating sagot dito is letter B. Age is the strongest risk factor for the developing of your Alzheimer's disease. Then next, for question number 59, nicotine causes which of these changes in the body? A. Lowers body temperature, B. Raises heart rate, C. Raises blood pressure, or D. B and C. So remember, nurses, that nicotine is one of the main chemicals in tobacco and it is the most addictive substance in tobacco. So ito po yung reason kung bakit nagiging addict po yung mga naninigarilyo, kasi nga yung sa nicotine po yun, okay? So nicotine is the most addictive substance in tobacco smoke, okay? So the correct answer here in your number 59 is letter D, B, and C. Why? Because nicotine temporarily increases the heart rate by 2 to 3 beats per minute and increases the blood pressure in short term because it constricts the blood vessels. So again, so nicotine temporarily increases the heart rate by 2 to 3 beats per minute, and it also increases the blood pressure in short term because it constricts the blood vessels. Okay, so the correct answer here is letter D. Then next, for question number 60, what happens when nicotine comes into contact with the brain? A. Tissues swell, B. Dopamine is released, C. Nerve centers shut down, or D. Adrenaline decreases. So take note, nurses, that when nicotine comes in contact with the brain, dopamine is released. So this neurotransmitter produces natural high within 7 to 10 minutes of inhaling your nicotine. So pag nanigarilyo po ang isang lalaki o isang tao, okay, so yung nicotine doon, pwede po siyang mag-cause ng natural high component within 7 to 10 minutes of inhaling. So take note also that nicotine is CNS stimulant and it also decreases the sensation of pain. So the correct answer here is letter B. Dopamine is released when nicotine comes in contact with the brain. B is the correct answer here. Then next, for question number 61, how does dependence on nicotine develop? A. Nicotine changes the pattern of nerve signals in the brain. B. Peer pressure makes it hard to quit. C. Mental habit is too hard to break, or D. Physical craving is too strong. Okay? So, bakit nagkakaroon ng dependence on nicotine? So, the correct answer here is letter A. Nicotine changes the pattern of nerve signals that control physical actions, behavioral control, and memory. So, letter A is the correct answer. So, nicotine changes the pattern of nerve signals in the brain. So, A is the correct answer here. Okay? So, number 61, letter A. Then next, for question number 62, what's the most common reason for not quitting? A. Smoking eases stress. B. Craving is too strong. C. Worried about weight gain. Or D. Enjoy it too much. Okay? So anong rason daw? Ano daw ang pinaka most common reason for not quitting of using nicotine or smoking? So remember, nurses, that stress is also one of the main reason given for relapsing when trying to quit smoking. Smokers uses nicotine to help them cope with stress. So the most common reason for not quitting here is letter A. Smoking eases stress. So A is the correct answer for question number 62. Then next, for question number 63, the risk for death by heart attack or coronary heart disease goes down how soon after you quit smoking? A. 20 years, B. 10 years, C. 3 years, or D. 1 year. Okay? So take note, nurses, that soon after quitting smoking, the risk for death by heart attack or coronary heart disease goes down for 1 year. So the correct answer here is letter D. Then after 15 years of smoke-free, your risk drops to that someone who never smoked. Okay? So after 15 years, magda-drop po lalo yung inyong risk for your death by heart attack or coronary heart disease by that someone who never smoke. Katulad ka na ng mga taong hindi talaga naninigarilyo. After 15 years pa po yun. But right after quitting your smoking, your risk of death of your heart attack goes down to 1 year. Then next, for question number 64, Ace is a well-informed nurse on smoking cessation program of the Department of Health. As a next step to his decision to stop smoking, Ace needs A. Commitment, B. Motivation, C. Information, or D. Skills to implement change. So remember, nurses, that if we say smoking cessation program, we have your 5 A's here. So we have your first A, we have your ask, okay? So ask about tobacco use. So identify and document tobacco use status for every patient at every visit. The next A is advice to quit. So advice to quit in a clear, strong, and personalized manner, urge every tobacco user to quit. And next A is assess. Assess willingness to make a quit attempt. Is the tobacco user willing to make a quit attempt at this time? And next A is assist in quit attempt. For the patient willing to make a quit attempt, offer medication and provide or refer for counseling or additional treatment to help the patient quit. For patients unwilling to quit at the time, provide intervention designed to increase future quit attempts. And letter A, yung last A natin, is arrange follow-up. So for the patient willing to make a quit attempt, arrange for follow-up contacts beginning within the first week after the quit date. And for patient unwilling to make a quit attempt, at that time, address tobacco dependence and willingness to quit at next clinic visit. Again, so always remember the 5 A's in your smoking cessation program. Ask, advise, assess, assist, and arrange. Again, ask, advise, assess, assist, arrange. Ask about tobacco use, advise to quit, assess willingness to make quit attempt, assist in quit attempt, and arrange follow-up. So back in your question number 64, so since Ace is a well-informed nurse now on smoking cessation program, no need na dito yung information kasi nga well-informed nurse naman na po siya. So ang next na kailangan na niya is your motivation. So the correct answer here is letter B, motivation is the correct answer for question number 64. Kasi hindi mo na kailangan ng information dyan. Kasi nga well-informed nurse naman na siya about the smoking cessation program ng DOH. So ang need na niyang kailangan ngayon is motivation. So B is the correct answer here. Then next, question number 65. Ace, a young overweight nurse, is smoking 5 to 10 sticks of cigarettes a day. He claimed that he learned to smoke to relieve his stress caused by toxic assignment in the ward. Along with smoking, he became a stress eater. He decided to undergo a lifestyle modification which begins with A. Eating the right kind of foods, B. Doing a regular daily exercise, C. A recognition of the impact of unhealthy habits, or D. A constructive and positive attitude in life. Okay, so take note, when we are starting to lifestyle modification, it always begins with a recognition of the impact of unhealthy habits. So the correct answer here is letter C. It always begins with a recognition of the impact of unhealthy habits. C is the correct answer for question number 65. Then next, for question number 66, the nurse is working in a drug rehabilitation clinic and is in the process of admitting a patient who says that she wants to be detoxified. It is important for the nurse to A. Identify the patient's stage of change, B. Realize the patient is ready to change, C. Instruct the patient that she will have to change her lifestyle, or D. Instruct the patient that relapses are not tolerated. So here, in your question number 66, it is important for the nurse to identify the patient's stage of change. So napaka-importante po yan na i-identify mo muna kung saang stage of change na po yung patient bago tayo mag-implement ng any change or lifestyle changes. So letter A is the correct answer here. Then next, for question number 67, the nurse is caring for a patient who has been trying to quit smoking. She has been smoke-free for 2 weeks but had 2 cigarettes last night and at least 2 this morning. What should the nurse anticipate? A. The patient does not want to and never will quit smoking. B. The patient will return to the contemplation or pre-contemplation phase. C. The patient will need to adopt a new lifestyle for the change to be effective. Or D. The patient must pick up her attempt right where she left off. So, bumalik ulit siya sa paninigarilyo. So, there's a relapse. Okay? So, take note that when relapse occurs, the person will return to the contemplation or pre-contemplation stage before attempting the change again. Okay? So, bago niya ulit yung change na yan or i-attempt niya ulit magbago, babalik ulit siya sa contemplation or pre-contemplation stage. So, the correct answer in your question number 67 is letter B. The patient will return to the contemplation or pre-contemplation phase. So, B is the correct answer here. Then next, for question number 68, the patient has quit smoking and has been smoke-free for the past 2 years. Of the following stages, which best fits her current stage of change? A. Contemplation, B. Preparation, C. Action, or D. Maintenance. So, para mas maintindihan po natin ito, kailangan alamin natin kung ano ba yung mga stages of change kapag meron po tayong smoking cessation, okay? So, A, B, C, or D ba ang sagot dyan? So, take note in your stages of change, we have your pre-contemplation, contemplation, preparation, action, and maintenance stage. Okay? So, stage 1 is the pre-contemplation. So, there's an intention to change pa lang dito. So, intention to change, that is under the pre-contemplation stage. Then next, so to considering a change within the next 6 months, kapag gusto niyang magbago within the next 6 months, that is under the contemplation stage. And to making small changes, kapag meron ng mga konting nagbabago, that is the preparation stage. And to actively engaging in strategies to change behavior, that is under the action stage. And to maintain a change behavior, that is maintenance stage. So since sa ating situation, 2 years na po siyang smoke-free, ang patient natin dito ay masasabi na natin nasa maintenance stage of change kasi maintain na po niya yung ating change behavior. So, the correct answer here is letter D. Okay, so maintenance stage na po yan kasi na-maintain na po niyang smoke-free po siya for the past 2 years. Okay, so maintenance stage na po yan. Then next, a nurse is discussing the benefits of smoking cessation with the client. The nurse informs the client that smoking cessation will reduce his risk for cancer, improve his respiratory status, and enhance the quality of his life. The client discusses his feelings on smoking cessation and verbalizes a desire to quit smoking. So what type of counseling did the nurse provide to this client? A. Long-term counseling, B. Developmental counseling, C. Motivational counseling, or D. Situational counseling. Okay, so dito, ang type of counseling na ginawa ni nurse is motivational counseling. Why? Kasi yung patient natin, nag-verbalize po siya a desire to quit smoking. So, nagkaroon po siya ng desire to quit smoking. So, na-motivate po siya sa sinabi ni nurse. So, the correct answer here is letter C. Motivational counseling po ang ginawa ng ating nurse dito. Okay, so number 69 is letter C. Then next, for question number 70, which of the following substance in cigarettes is known as the most carcinogenic? A. Nicotine, B. Carbon monoxide, C. Carbon dioxide, or D. Tar. Okay? So yung nicotine natin, nicotine is the most addictive substance of your cigarettes. And the most known carcinogenic substance of cigarette is your tar. Okay? So the correct answer here is tar. Tar is known as the most carcinogenic substance of cigarette, while your nicotine is the most addictive substance of your cigarette. So letter D is the correct answer for question number 70. Okay, so next, question number 71. Using a psychoanalytic theory as your frame of reference, your answer is that alcoholism is a fixation in what stage of child's development? A. Preschool stage, B. Anal stage, C. Oral stage, or D. School age stage. Okay? So take note, if we say fixation, fixation is the stagnation of a child towards the next stage of its development. So take note, nurses, that alcoholism is a fixation during your oral stage. Okay, so during the infancy oral stage, there's a fixation that causes alcoholism during your adolescence or adulthood period. So letter C is the correct answer here. And next, question number 72, what should be the priority nursing diagnosis for a client experiencing alcohol withdrawal? A. Risk for injury related to central nervous system stimulation. B. Disturbed thought process related to tactile hallucinations. C. Ineffective coping related to powerlessness over alcohol use. Or D. Ineffective denial related to continued alcohol use despite negative consequences. So take note, ang tanong po dito is priority nursing diagnosis. So, ang priority natin dito kapag may mga alcohol withdrawal is the safety. Okay? Safety kasi meron tayo ditong increased risk for injury related to central nervous system stimulation. So, the correct answer here is letter A. Kasi priority nursing diagnosis po ang tinatanong dito. So, risk for injury related to central nervous system stimulation is the correct answer here. So, A is the correct answer for question number 72. Then next, question number 73, a patient discharged from an alcohol rehabilitation program was on clonazepam or clonopin 0.5 mg 3 times a day. Several months later, he reported having insomnia, shakiness, sweating, and on seizure. Which of the following questions should you ask first? Ask if he A. has stopped taking the clonopin suddenly, B. has been drinking alcohol with the clonopin, C. has developed tolerance to the clonopin and needs to increase the dose, or D. is having a panic attack and needs to take extra clonopin. Okay? So take note, ang tatanungin natin dito una is kung biglaan ba niyang itinigil yung pag-take niya ng clonazepam. Okay? Kasi nakakapag-cause po yan ng ating alcohol withdrawal. So the correct answer here is letter A. Ask if he has stopped taking the clonopin suddenly. So the correct answer here is letter A kasi yung signs and symptoms niya ay mga pinapakita ng mga alcohol withdrawal. Okay, so letter A is the correct answer here. Then next, question number 74, which of the following assessment data provides the best information on the patient's physiologic response and the effectiveness of the medication prescribed for alcohol withdrawal? A. Sleep pattern, B. Evidence of tremors, C. Vital signs, or D. Nutritional status. Take note, physiologic response po ang hinahanap natin dito with the effectiveness of the medication. So the best information on the patient physiological response and effectiveness of the medication prescribed for alcohol withdrawal is through its vital signs. Okay? So letter C is the correct answer here. Lumalabas po yan palagi sa board exam. Ang dami nagkakamali kasi sinasagot nila dyan is nutritional status. Wala pong kinalaman dyan yung ating nutritional status kapag physiologic response ng gamot ang pinag-uusapan. So ang sagot natin dyan lagi is vital signs. So letter C is the correct answer here. Then next, for question number 75, one of the patient is manifesting signs and symptoms of alcohol withdrawal such as tremors, diaphoresis, and hyperactivity. Blood pressure is 190/92 millimeters mercury and pulse rate is 92 beats per minute. Which of the following medication should you expect to be ordered for this patient? A. Lorazepam or Ativan, B. Naloxone, C. Haloperidol, or D. Benzotropine or Cogentin. Okay? So take note, meron po tayo ditong alcohol withdrawal and the most common drug na binibigay natin dito is your Lorazepam. So letter A is the correct answer or the Ativan. Okay? So A is the correct answer here. Okay? So bukod po sa ating Lorazepam or Ativan, pwede rin po tayo magbigay ng Librium or yung tatawag natin na chlordiazepoxide. Okay? So letter A is the correct answer here. Mali po yung ating letter B, Naloxone, kasi ang Naloxone, that is your antidote for your opiates or narcotic toxicity like your meperidine and morphine toxicities. Okay? So the correct answer here is letter A, Lorazepam or Ativan, that is for your alcohol withdrawal. Then next, for question number 76, Lawrence has a history of alcohol abuse, so she was started on antabuse. Which of the following is a common side effect of this drug? A. Hypertension, B. Bradycardia, C. Depression, or D. Elation. So, antabuse po ang tanong dito. Ano daw ang pinaka-common side effect ng antabuse? So, the correct answer here is your depression. So, depression is the most common side effect of your antabuse drug. So take note that your antabuse is one of the drug that supports treatment of your alcohol abuse. Okay, so dito nagproproduce po siya ng alcohol sensitivity. Kapag ikaw ay nag-take ng antabuse, bawal kang mag-take ng mga products with ethanol content. So we have your common side effect of your antabuse, which is the depression. So letter C is the correct answer for question number 76. Then next, question number 77, a housewife whose alcoholic husband is undergoing detoxification process for alcohol. She asked the importance of increasing fluids during this time. Which of the following would be your most appropriate response? Fluids blank. A. Help remove alcohol from the body. B. Prevent bladder complications. C. Prevent gastrointestinal complications. Or D. Help prevent dehydration because alcohol is diuretic. So your most appropriate response for the need of increased fluid during your detoxification is letter D. Okay? Fluid helps prevent dehydration because alcohol is diuretic. So yan pong pinaka-importanteng response mo. So take note that alcohol is diuretic, so there is an increased need for fluids or water kasi nga that is to prevent your dehydration. So D is the correct answer here. Then next, for question number 78, while caring a client with your post-traumatic stress disorder, the family notices that a loud noise causes a serious anxiety response. Which of the following explanation by you would help the family understand the client's response? Letter A, after the trauma, the client cannot respond to stimuli in an appropriate manner. B, clients often experience extreme fear about normal environment stimuli. Or C, environmental trigger can cause the client to react. Or D, the response indicates that another emotion problem needs investigation. So, the correct answer here is letter C. Take note that in your PTSD, environmental trigger can cause the client to react emotionally. So letter C is the correct answer here. Then next, for question number 79, the nurse suspects that the client may have PTSD. It would be most important for the nurse to assess the client for A. An eating disorder, B. Suicide, C. Schizophrenia, or D. Sundowner syndrome. So mali dito yung ating letter D kasi common niya sa ating dementia or Alzheimer's disease. So the correct answer here is letter B. Suicide. So it would be most important for the nurse to assess the client for suicide po yan. So B is the correct answer here. Then next, for question number 80, which clinical manifestation supports the diagnosis of post-traumatic stress disorder or PTSD in this client? 1. Agitation. 2. Flashbacks. 3. Depression. 4. Hypervigilance. 5. Tremors. Okay? So, alin daw dito yung mga diagnosis or mga manifestation that will support your PTSD diagnosis? So, remember nurses that agitation, flashbacks, depression, and hypervigilance are all manifestation of your post-traumatic stress disorder. Okay? So, it happens or it occurs within the first 3 months after your traumatic experience, or it may also be evident up to years after your experience. So, mali dito yung ating number 5 kasi hindi po yan manifestation ng ating PTSD yung tremors. So, only 1, 2, 3, and 4. So, the correct answer here is letter B. So, 1, 2, 3, 4, that is your post-traumatic stress disorder manifestations. Then next, for question number 81, you do a physical assessment on newly admitted patient in the psychiatric unit. Which type of therapeutic touch is used to assess the patient's skin turgor? A. Social polite touch. B. Friendship warm touch. C. Functional professional touch. Or D. Love intimacy touch. Okay, so isa-isahin po natin yan. Pag social polite touch, that is, example for your social polite touch is handshaking. Okay? Sa letter B naman natin, friendship warm touch. Example naman po natin dyan is placing arm across the shoulder. Okay? Placing arm across shoulders. And pag sinabi naman natin functional professional touch, this touch is used to accomplish tasks like your professional physical therapist, positioning your patient, performing therapeutic massage to your patient. We have also your skin turgor assessment, taking of your pulse, and taking of your blood pressure. So that is a functional professional touch. And pag sinabi naman po natin love and intimacy touch, example naman po dyan is holding hands and embracing of your two close individuals. So since in your question number 81, the nurse assesses the patient's skin turgor, that is considered as a functional professional touch. So letter C is the correct answer for question number 81. Then next, for question number 83, you put your arms around the shoulder of an elderly patient. So which type of touch is this? A. Love intimacy touch. B. Social polite touch, C. Friendship warm touch, or D. Functional professional touch. Again, so if you are placing your arm across the shoulder of your patient, that is a form of friendship warm touch. So letter C is the correct answer here. Okay? So C pa rin po ang sagot natin dyan. Friendship warm touch naman po yan. Kasi yung love intimacy touch natin, that is holding hands and embracing. Okay? Yung social polite touch naman natin, example dyan is handshaking. While your functional professional touch, that is touch to accomplish tasks like your physical therapist, positioning patient, therapeutic massage, skin trigger assessment, BP assessment, and your pulse rate assessment. Yun naman yung ating functional professional touch. So the correct answer here is letter C, friendship warm touch lang po yan. Then next, for question number 84, Nurse Claire greets the client, ang ganda mo ngayon na. What term is used to describe the speech pattern being used when the client imitates, okay? Imitates or repeats what the nurse is saying. So, pag inulit ng patient mo yon, inulit-ulit niya yung ang ganda mo ngayon na, ang ganda mo ngayon na. So, that is a form of echolalia. So, from the word of imitates or repetition, that is echolalia word po yan. Kasi pag sinabi naman natin clang associations, yan naman po yung mga words na may mga rhyming, okay? So, yung neologism naman, yan naman yung creation of words na sila lang po yung nakakaintindi ng ibig sabihin nun. That is your letter D, echolalia, that is the imitation of words and repetition of words by others. So, letter D, echolalia, that is known as the parrot-like speaking. So, D is the correct answer here. Then next, for question number 85, which speech pattern is exhibited by the client stating, I will take a pill if I go up the hill, but not if my name is Bill. I don't want to kill. A. Verbigeration. B. Neologism. C. Word salad. Or D. Clang association. So, ito yung sinasabi natin kanina na kapag may rhymes po yung kanyang sinasabi, that is a form of your clang association. So, clang association. So, rhyme niya yung mga sinasabi niya. So, I will take a pill, and if I go up to the hill, but not if the name is Bill, I don't want to kill. So, may rhyming po yung words niya dyan. So, that is a clang association. Pag sinabi naman po nating verbigeration, nag-e-echo po yung sinasabi niya. Example, ang ganda ko, ang ganda ko, ganda ko, ganda ko. So, that is your verbigeration. Okay? Pag may echoing, that is your verbigeration of words. Then next, for question number 86, a client diagnosed with schizophrenia states, gusto ko nang umuwi, umuwi, umuwi. This is an example of which speech pattern? A. Clang associations. B. Word salad. C. Verbigeration. Or D. Neologism. So, hindi na po pasok dyan yung clang association kasi wala pong rhyming. Hindi rin pasok dyan yung neologism kasi hindi naman po yan mga new words na hindi natin naiintindihan, na siya lang nakakaintindi. So, that is a form now of your verbigeration. So, bakit sinabi kong verbigeration? Kasi merong echoing yung last word like your umuwi, umuwi, umuwi. Yun. Paulit-ulit niya yan na sinasabi, that is your verbigeration of words. So, letter C is the correct answer here. Nga pala, mali din pala yung ating word salad kasi pag sinabi nating word salad, that is your schizophrenia. So, meron po tayo dyang jumbled word without meaning or meaningless para sa mga listener, okay? So, from the word itself na lang na word salad, halo-halo na po yung mga sinasabi niyang words. So, interconnected po yung mga words na yan and meaningless po yan sa mga listeners. So, sasabihin niya, blue I rain, the cat smelly house, walk goes slowly in the rain, in the fever. Gumaganyan na siya. Iba-iba na yung sinasabi niya. That is a word salad na. So, unassociated yung mga word. Nagmimix yung words at saka phrases. That is a word salad. So, mali din po yan. Okay? So, pag sinabi ng patient mo na, I want to go home, 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 or gusto ko nang umuwi, 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 that is your verbigeration of words. So, letter C is the correct answer for question number 86. Okay? Then, next question is question number 87. Which of the following techniques is used by the nurse if she uses exact words in clarifying response of the patient? So, keyword exact words in clarifying responses of the patient. So, take note that repeating the exact words by your patient is your restating. So, letter D is the correct answer here. So, pinaka-best example niyan sa board exam is sasabihin ng patient na, I think I should leave now. Then, sasabihin ng nurse na, do you think that you should leave now? So, that is an example of your restating therapeutic communication. So, letter D is the exact words. So, restating is repeating the exact words in clarifying response of the patient. So, letter D is the correct answer here. Then next, question number 88, you heard another staff nurse telling a worried patient, cheer up, just keep the faith. This communication technique is an example of A. Using a cliche, B. A judgmental response, C. Changing the subject, or D. Giving advice. So take note, this is an example of using a cliche, okay? And that is a non-therapeutic communication technique. So letter A is the correct answer here. Cheer up, just keep the faith is a cliche. So A is the correct answer here. Then next, question number 89, Nurse Vico assesses the client for depression. So which of the following is a key indicator for clinical depression? A. Anger due to pain experience. B. Feeling of excessive guilt. C. Anorexia and weight loss. Or D. Inability to care for one's physical self. So keyword, key indicator for clinical depression. So the key indicator for clinical depression here is the inability to care for one's physical self. So neglect in your personal care. So letter D is the correct answer here. So D, inability to care for one's physical self, is the key indicator for clinical depression. Then next, question number 90, the nurse who uses appropriate therapeutic listening skills will display which best behavior? A. Presume an understanding of the patient needs. B. Read quickly to the message. C. Reassure the patient that everything will be fine. Or D. Absorb both the content and the feeling which patient is conveying. So, tanggal agad dito yung ating letter C kasi everything will be fine. That is a false reassurance. So, mali po ang ating false reassurance. That is a non-therapeutic skill. So, mali po ang ating letter C. So, the correct answer here is letter D. Absorb both the content and the feeling which the patient is conveying. So, that is the most appropriate therapeutic listening skill, okay? So, letter D is the correct answer here. D. Then next, question number 91, a nurse believes that the nurse-patient relationship is partnership and that both are equal participants. So, which term should the nurse use to describe this belief? A. Critical thinking. B. Authentic. C. Mutuality. Or D. Attend. So, keyword in your question number 91, equal participants. So, that is mutuality. So, letter C, mutuality is the correct answer for question number 91. Then next, question number 92, a nurse is standing beside the patient's bed. How are you doing? Said the nurse. I don't feel good, said the patient. Which of the following communication elements is categorized as feedback? Okay? So, pag sinabi nating feedback, feedback is the response to the information delivered. So, the correct answer here is, ano bang feedback? Ang tanong is, how are you doing? So, the feedback is, I don't feel good. So, the correct answer here is letter B. I don't feel good is the feedback in your elements of your communication. So, letter B is the correct answer here. Then next, for question number 93, before meeting the patient, a nurse talks to other caregivers about the patient. Which phase of the helping relationship is the nurse in with this patient? So, A. Termination. B. Working phase. C. Orientation phase. Or D. Pre-interaction phase. So, during the orientation phase, letting the patient know when to expect the relationship to be terminated occurs in the orientation phase. While in your pre-interaction, it occurs before the nurse meets the patient. And in your working phase, it occurs when the nurse and the patient work together to solve problems and accomplish goals. And for termination phase, it occurs during the ending of the relationship. So, ang tanong natin dito is, before na ma-meet pa ni nurse yung ating patient, ay nakipag-meet muna siya sa caregiver. That is an example of your pre-interaction phase. So, that is under your pre-interaction phase. So, here in question number 93, before meeting the patient, a nurse talks to other caregivers about the patient. That is under your letter D, pre-interaction phase pa po yan. So, D is the correct answer for question number 93. Then next, for question number 94, which technique will be most successful in ensuring effective communication? The nurse uses A. Interpersonal communication to change negative self-talk to positive self-talk. B. Small group communication to present information to an audience. C. Intrapersonal communication to build strong teams. Or D. Transpersonal communication to enhance meditation. So, the most successful in ensuring effective communication here is letter D, transpersonal communication to enhance meditation. So, D is the correct answer here. So, take note that transpersonal communication is the interaction that occurs within a person's spiritual domain. So many people uses prayers, meditation, guided reflection, and religious rituals or other means to communicate with their higher power. So the most successful in ensuring effective communication here is letter D, transpersonal communication to enhance meditation. So D is the correct answer here. Then next, for question number 95, during the initial home visit, the nurse lets the patient know that the visits are expected to end in about a month. Which phase of the helping relationship is the nurse in what patient? A. Pre-interaction, B. Working, C. Termination, or D. Orientation. So nasabi ko na yan kanina, so during the initial home visit, if the nurse lets the patient know that the visit will be expected to end in about a month, that is under the orientation phase. So letter D is the correct answer in your question number 95. Orientation po yan. Then next, for question number 96, a patient's unresolved feelings related to loss would be most likely observed during which phase of the therapeutic nurse-patient relationship? A. Trusting, B. Working, C. Orientation, or D. Termination. So, kapag meron po tayong mga unresolved feelings related to loss, it would be most likely observed during your termination phase of your therapeutic nurse-patient relationship. So the correct answer here is letter D, termination phase po yan. Then next, number 97, Nurse Reynalyn is speaking to the mother of 16-year-old male adolescent. The mother has concerns about her son. Which of the following statements by the mother should indicate to the nurse that the adolescent is at risk for suicide? A. His favorite teacher committed suicide a few weeks ago. B. He has slept 9 hours each night for the past 2 years. C. He is very religious and attends services twice a week. Or D. He spends most of his time with his 2 school friends. So here in our question number 97, the correct answer here is letter A. His favorite teacher committed suicide a few weeks ago. So take note, nurses, that adolescents are at risk for copycat suicide if a peer or significant role model has recently committed suicide. So adolescents often act impulsively and can be easily frustrated. So letter A shows your role model, yung favorite teacher niya, nag-commit ng suicide. So pwede pong i-copycat yan ng ating adolescent. So letter A is the correct answer here. Then next, for question number 98, Nurse Virgie is visiting a client with stage 3 Alzheimer's disease. Which of the following is characteristic of this stage? A. Wandering at night, B. Irritability, C. Dementia, or D. Failure to recognize familiar objects. Okay? So, yung letter A natin, that is under the stage 2 of your disease. Ang stage 3 natin dyan is letter D. Failure to recognize familiar objects. So, the correct answer here is letter D. So, remember nurses that under the stages of Alzheimer's disease, in your stage 1, meron na po ditong memory loss. So, forgetfulness at stage 1. Stage 2 is wandering at night, lumalabas na sa gabi at nagwawander sa mga daan. Stage 3, agnosia or failing to recognize familiar objects. And stage 4 is failure to communicate na yan. Okay? So, yan po yung mga stages ng ating Alzheimer's disease. Then next, for question number 99, a 79-year-old with Alzheimer's is known to wander at night. This is common in which stage of the disease? A1, B2, C3, or D4. So, kakasabi lang po natin, kapag yung patient na may Alzheimer's is nag-wander at night, that is stage 2 of the disease. So, letter B is the correct answer here. So, yung letter A kasi, forgetfulness or yung ating dementia yan. Yung stage 3 naman po natin, that is your agnosia or failure to recognize object. And yung stage 4 natin is failure to communicate na po yan. Again, so wander at night, that is stage 2 of your Alzheimer's disease. So, letter B is the correct answer here. And down to our last number or last item for your psychiatric nursing, you are talking to the patient when suddenly she's making up stories to fill in any gaps in her memory. This is known as A. Sundowning, B. Delirium, C. Confabulation, or D. Agitation. So the correct answer here is confabulation kasi making up stories to fill any gaps in memory is a form of confabulation. So letter C is the correct answer here. Yung sundowning naman, yan yung nagiging confused yung patient natin, especially kapag nag-sunset na or sundown na or kapag evening na po yan. Nagiging confused yung pasyente, irritable at nagpe-pace na po siya. So letter C is still the correct answer is confabulation. C is the correct answer here.